Today's session, if I want to talk about today's session is all about the thorax. So we are going to complete the details of the thorax in this session. So actually the first topic which I want to start is the thoracic wall and the substance fascia. This will be the first topic which I will cover up. So we will have the discussion of these topic, and then we will move on with the further. So systematically I have to cover entire thorax in this session. So I will start with the thoracic wall, substance fascia, then we will move on with the intercostal space, then the mediastinum, the pericardium, the heart and its blood supply, the nerve supply, the cardiac plexus. Then we will move with the pleura and the lung, and also I will talk about the bronchopulmonary segments. We will talk about the trachea, esophagus, esophagus, venous system and that of thoracic duct. So this is all what I am going to cover up in this session. So without wasting much of time, I'm so sorry, I was because of some connection it was just delayed for 10 minutes late it started. It's okay, let's start with this. So let's start with the first topic, that is thoracic wall. So I would like to tell you about the thoracic wall. So if I'm talking about the thoracic wall, it's actually formed posteriorly by the thoracic part of the vertebral column. So what is the posterior aspect? So posteriorly it is formed by thoracic part of vertebral column. So we know that the vertebral column is having a cervical part, thoracic part, lumbar and the sacral part. Thoracic wall, its posterior aspect is having the thoracic part of vertebral column, and anteriorly, if I talk about the anterior aspects, anteriorly it is bounded by sternum and costal cartilages. Sternum and costal cartilage. So this is anterior aspect. What about lateral aspect? If I am talking about laterally, the boundary, so laterally it is bounded by the ribs and intercostal space. So that means, in short, we have done with all the thoracic wall boundaries. We are knowing that on the posterior aspect it is bounded by the thoracic part of the vertebral column. Anteriorly we have got the sternum and the costal cartilages, and laterally there is ribs and the intercostal space. So this is overall boundary of the thoracic wall. Now what about the floor? The floor of the thoracic cavity is formed by the diaphragm, and the roof is formed by suprapleural membrane. So let's talk about. So done the thoracic wall. So you can just highlight thoracic wall. So my dear students and my dear aspirants for the examination of FMG, so it is not only useful for the FMG examination, the NEET PG aspirants can also see this session. This is highly beneficial for them, because the portion what is covered in the FMG and the NEET PG examination is more or less, the topics are similar. So I want both of you, both of the category of students to watch this. And if I talk about thoracic wall, so you have to know not only the anterior, posterior, lateral aspect, you have to know that the roof is formed by suprapleural membrane. What is suprapleural membrane? It is also called as substance fascia. We will talk about the substance fascia in detail. I will give you the details of its attachment and its function. And the floor is formed by the diaphragm. So let's write about the floor and the roof. Okay, so write about roof. Roof is formed by suprapleural membrane and floor is formed by the diaphragm. Okay, the floor is formed by the diaphragm. So we have done with the roof, floor, anterior, posterior aspect. I hope everybody has written this. I would also like to tell the thoracic wall. If I want to approach the thoracic wall and we are approaching it from the superficial to deeper aspect. If I approach from superficial to deeper aspect, the structures being penetrated will be the skin, the superficial fascia, the deep fascia and the muscles. Okay. So that is also important for you. So you can just write this point. So thoracic wall. So if I am talking about thoracic wall, the structures penetrating or the structures being pierced from superficial to deep, and the structures being penetrated is, the first structure being penetrated is the skin, the second structure is superficial fascia, and the third structure penetrated is the deep fascia, and the fourth structure being penetrated is the muscles. Okay, so this is all about the structures being penetrated as you proceed from superficial to deep. The next important point to know is to know the details of Simpson's fascia. So let's move on to the next topic, that is Simpson's fascia. So everybody is able to see this diagram and they can appreciate this. Okay, it's visible. So the other name of Simpson's fascia is, if I talk about the Simpson's fascia, the other name of Simpson's fascia is, it is also called as suprapleural membrane. Actually, it is also termed as the diaphragm of superior thoracic aperture. So it's also important that a single structure can be named by multiple names can be used. So it is important that you should have an idea of that names. So what are the two other names of Simpson's fascia? It is also called as suprapleural membrane, or it is also called as the diaphragm of superior thoracic aperture. So please write it. I just want everyone to have a look on this image. So if you are seeing this image, you can see the suprapleural membrane. So what is it? This is the suprapleural membrane which I have highlighted. Okay, this structure is the suprapleural membrane. Now that means this is covering the superior aspect of the lung and the pleura. It is a protective covering for the apical or the cervical pleura, as you can see in this diagram. And suprapleural membrane is also termed as Simpson's fascia or diaphragm of the superior thoracic aperture. So please note down that. So I just want everybody. So what is the other names of Simpson's fascia? So the other name of Simpson's fascia is, it is also called as it is also termed as suprapleural membrane or diaphragm of superior thoracic aperture. Got it? So these are the other terms which is used for Simpson's fascia. Now, if you will see the Simpson's fascia as shown in this diagram, as you can see. So anyone wants, if any of the student is having, so good morning everyone. So no one wished good morning today. What happened? Good morning everyone. So I just want to tell everybody that if you are not understanding anything or you want me to repeat it or show the image once again, and if you are not able to write on the notes, it's a live session. Okay, we have to interact with each other so that maximum benefit can be taken from this session. So that is highly important for you. Okay, dear. So yes, Tarun is here and Tarun is also wishing good morning. Yes, dear. So this is tent-like. What you can appreciate in this image, that this structure which has been seen is a tent-like structure. This is tent-like structure which is actually it's a part of thoracic inlet on either side, and it is made of dense fascicle sheet. So if I talk about the suprapleural membrane, it is composed of dense fascicle sheets. So Simpson's fascia. So please write down about Simpson's fascia. So write down the heading Simpson's fascia. Okay. So substance fascia. The other name of substance fascia is suprapleural membrane, and the part of thoracic inlet. So it is made of dense. It is made of dense fascicle sheet. Dense fascicle sheet. It is made of dense fascicle sheet. Now talking about the attachments and relations. So if I talk about the apex of substance fascia, the apex of substance fascia is attached to the transverse process, tip of the transverse process of 7 cervical vertebra. And if I talk about its base is attached to the inner aspect or inner border of the first rib and its adjoining costal cartilage. So attachment. So if I talk about the apex of substance fascia, the apex of substance fascia is attached to tip of transverse process of C7 cervical vertebra. C7 cervical vertebrae. The base, and if I talk about the base is attached to inner border of first rib and its costal cartilage. Okay, and its costal cartilage. Its superior surface is related. If I talk about the superior aspect of substance fascia, the superior aspect of substance fascia is related with subclavian vessels, and inferior surface is related with the cervical pleura covering the apex of the lung. So please complete this. Its superior surface is related to cervical pleura covering apex of lung, So its superior surface is, if I talk about superior surface, so basically superior aspect, if I talk about, it is having the crossing of subclavian vessel, and inferiorly it is related with the, so its superior aspect is related to, so basically just write it more clearly. I think we have to write here. So please make it, superior surface is related to subclavian vessels, and its inferior surface or inferior aspect is related with the covering of the apex of the lung, that is called as cervical pleura. Okay, is it okay? Now you are not got confused about this? Yeah. Now it's also important to know the function of substance fascia. The next important point which everybody should pay attention is the functions of substance fascia. So if I am talking about function of the substance fascia, so I just want to firstly show you this image. So all of you just concentrate on this image to understand the attachment. So my dear students, you can appreciate that the upper attachment, if I talk about its upper aspect, it is attached to the transverse process of C7 cervical vertebra. And if you will see, its base is attached with the first rib as shown in the diagram. Okay, and as I told you, superior aspect, it is crossed by which structure? It is crossed by subclavian vessel, and it is forming a protective covering for the cervical pleura and the apex of the lung. So in this diagram, we can actually appreciate what I have told you, and we have already written that. Next important thing is to know the function and morphologically the aspect of the substance fascia. So all of you please write on the heading function of substance fascia. Functions of substance fascia. Functions of substance fascia. So the two important function is it protects underlying cervical pleura. It is protecting the underlying cervical pleura, which is called as the apex of lung. And the second function is it resists the intrathoracic pressure during, it resists the increase of intrathoracic pressure during respiration. Thoracic pressure during respiration. Now, morphologically, substance fascia is, so please write down morphological aspect. Morphologically, substance fascia represents the degenerated tendon of, it represents the degenerated, it represents the degenerated tendon of scalenus minimus muscle, minimus muscle. It represents the degenerated tendon of scalenus minimus muscle. So we have done with this. Now I would like to come with the clinical aspect. Now the next important thing is to know the clinical aspect related to the substance fascia or the cervical rib. So there is a one condition which everybody should know, that is called as thoracic inlet syndrome or thoracic outlet syndrome. Both are similar terms, so please don't get confused. That thoracic inlet and thoracic outlet syndromes are basically similar things. So yes, yes Tarun, are you understanding? Any doubt, please let me know. Tarun, those who are live, please let me know, are you understanding? Any doubt? Okay, okay. So thoracic inlet syndrome, actually the subclavian arteries and the, let me slightly enlarge this. So if we are talking about the subclavian, yeah, if we are talking about the subclavian arteries and that of cervical rib, so actually if we have got lower trunk of brachial plexus and subclavian arteries, and if there is an extra rib in the cervical region, together we have got 12 pairs of the ribs in the thoracic region. But if we are having an extra rib in the cervical region, what can happen? They can cause a compression over the subclavian vessels and trunk, lower trunk of brachial plexus, and the reason will be either cervical rib or the hypertrophy of the scalenus muscle, and that could lead to thoracic inlet syndrome. They can lead to the compression, and the sign and symptoms will be corresponding to the features. Like for the lower trunk of brachial plexus, if it is compressed, it will cause numbness, tingling sensations and pain along the medial side of forearm and the hand, and also can lead to the wasting of small intrinsic muscles of the hand, because basically lower trunk of brachial plexus is having the root value C8 and T1, and that is the reason they can be compressed. Ischemic syndromes can also be seen in the upper limb, such as pallor, coldness of the upper limb, weak radial pulse due to compression of subclavian artery. So please write down the details of this syndrome, thoracic inlet syndrome. So the reason of this is either the scalenus group of muscle is hypertrophied, or there is a compression of the subclavian arteries and the lower trunk of brachial plexus. Now one more image is there which will, so the other name of thoracic inlet syndrome is also thoracic outlet syndrome, both a similar thing. Now here in this diagram, what you can appreciate here, this is the cervical rib. So this is exactly the cervical rib. Now in this diagram, and this is the muscle. So basically muscles, these are the muscles. So basically what can happen due to the cervical rib, there can be compression of, or due to hypertrophy of scalenus group of muscle, there can be compression of lower trunk of brachial plexus and that of cervical, that of subclavian vessels, and that can lead to thoracic inlet syndrome or outlet syndrome. So I just want everybody to write down the details of it. So please write down thoracic inlet syndrome. Thoracic inlet syndrome. Subclavian vessels and lower trunk of brachial plexus arches over the first rib. Hence, they may be stretched and pushed up by the presence of congenitally hypertrophied scalenus anterior muscle or cervical rib. So this can be the reason, the cervical rib. So this can be the reason of compression of these structures and leading to the condition of thoracic inlet syndrome. Now, this leads to, just a minute, this leads to thoracic inlet syndrome. Okay, this leads to thoracic inlet syndrome. Now, if I talk about thoracic inlet syndrome, so further if I talk about this thoracic inlet syndrome, what is important for you to know, the sign and symptoms associated with it. So if I am talking about thoracic inlet syndrome, basically there the patient will complain of numbness. The patient will have the complaint of numbness, tingling, pain along the medial side of forearm and hand, wasting of small muscles of hand due to involvement of which trunk of brachial plexus. So in this case, there is involvement of lower trunk of brachial plexus due to involvement of lower trunk of brachial plexus. Okay, got it. Now next thing is to know about the ischemic syndrome in upper limb. So the other sign and symptoms which can be seen in this condition, so done with this. So the other sign and symptoms which can be associated in this condition, ischemic syndrome in upper limb, such as pallor and coldness of upper limb due to, and the reason is weak radial pulse. The patient will have weak radial pulse, and what is the reason of weak radial pulse? That is the compression of subclavian artery is the reason of weak radial pulse. So weak radial pulse due to compression of subclavian artery. Okay, now, so we have finished with this topic. The next topic which I want everybody to understand is the intercostal space. So can we move on to the next topic, that is intercostal space, which is highly important for you to understand all the aspects which is associated with it. So till now, if anybody is to any of the students has got any doubt, please let me know. Okay, so let me just check with the messages. Clear, ma'am. Okay, okay, okay. Precious. Okay, Tarun. Okay, Ranjit. Ranjit, good morning, dear. So yes, it's clear now till now. So now the next topic is intercostal space. It's a very important topic and the concept should be clear because we have got an important contents in the intercostal space. So I want everybody to have a detailed knowledge of intercostal space. Now, in normal layman term, if you want to understand what is intercostal space, so it is a space lying between the two ribs. Okay. So this is exactly the space which is located between the two ribs. So I just want you to see this image. I'm just enlarging this. Now you can appreciate this is the rib above. This is one rib above and this is the other rib below. So this is the rib above and this is the rib below. So exactly the space which is lying between these two ribs are termed as intercostal space. What is it? It is termed as intercostal space and you have to know the structures which is lying in this intercostal space, the muscles which is lying here, the name of the muscle, the name of vein, artery and nerve. Actually vein is the term used for this structure. So intercostal vein, intercostal artery and intercostal nerve. So basically from outside to inside you can see the structures. So basically I just want to show you the structure. So basically the most outermost structure which you are seeing here, which is shown in this image is the skin. So this is the skin. After skin we have got the superficial fascia and then we have got the muscle layer. So basically this is the skin which you are seeing. Then you have got the fascia. Then you have got the external oblique muscle, external intercostal muscle. Then you have got internal intercostal muscle and this is inner intercostal muscle. Other than that, you will have the parietal visceral pleura and in between the parietal and visceral pleura, you will have the pleural cavity. That means these are the layers of the structures. As you proceed from outside to inside, we will have the skin, we will have the superficial fascia, we will have the external intercostal muscle, internal intercostal muscle and innermost intercostal muscle, and then we will have also the endothoracic fascia, we will have the parietal and the visceral layer of pleura, and in between the parietal and visceral layer of the pleura we will have the pleural cavity. Okay, now what does the intercostal space contains? The structure which is lying in between intercostal space is the vein, artery and nerve, and we have got the intercostal muscles. We have got external intercostal muscle, internal intercostal muscle and innermost intercostal muscle. So I just want to show you a vertical section of intercostal space so that it becomes more clear to you. Yeah. So again you are going to appreciate the rib above. This is the rib above and this is the rib below. And this space which you are seeing is the intercostal space. Now here we will have vein, then we will have the artery and then we will have the nerve. This is the nerve. So basically you can appreciate the three structures, vein, artery and nerve is lying in this intercostal space. Okay, we have got from top to bottom, we have got the structures. The mnemonic to know the arrangement of structures in the intercostal space will be intercostal vein, intercostal artery and intercostal nerve. Now the arrangement of the muscles. So I will just use brown color for the muscles. So the most outermost muscle will be the external intercostal muscle, then we have got the internal intercostal muscle and then we will have the innermost intercostal muscle, which is this is the third innermost intercostal muscle. So basically what happens, we have got these three muscles. As you proceed from outside to inside, we have got external, internal and innermost intercostal muscle. Okay. Now exactly if I talk about the intercostal space or we are talking about the neurovascular plane. So the neurovascular plane is located between internal intercostal muscle and innermost intercostal muscle. So that is the area of neurovascular plane. So the nerves, the vein, the artery and the nerve is residing in the is residing exactly in the intercostal space, exactly in the neurovascular plane, which is exactly located between innermost and that of internal intercostal muscle. Okay. So the again in another image, this is taken from Gray's Anatomy, this image. The rib above, the rib below, external intercostal muscle, internal intercostal muscle and innermost intercostal muscle. So where is the neurovascular structure plane? Neurovascular plane made of vein, artery and nerve is residing between internal and innermost intercostal muscles. So I just want that you should also know the name. So we have got, if I am talking about intercostal space, the intercostal space is having intercostal muscles, is having intercostal vein, intercostal artery, intercostal nerves and intercostal lymph node. So basically the group of the name of the muscle which is residing in the intercostal space is the list of following muscle: external, internal and transverse thoracic. So actually transverse thoracic group of muscle is consist of three muscles, and what are the name of that muscle? They are called intercostalis intimus muscle, subcostalis and sternocostalis. So we have got these three muscles which together is called as the transversus thoracic group of the muscle. So transversus thoracic group of the muscle. So transversus thoracic group of the muscle. If I am talking about transversus thoracic group of the muscle, we have got following. We have got intercostalis intimus, subcostalis and sternocostalis. These are the transversus thoracic group of muscle. Done with this. Now let's see this image. So okay, you can also note down, if you want to note down, please write down neurovascular plane of thoracic wall is located between neurovascular plane of thoracic wall is located between internal and innermost intercostal muscle. Innermost intercostal muscle. Internal and innermost intercostal muscle. Neurovascular plane of thoracic wall is exactly located between internal and innermost intercostal muscles. Done with this. Now let's see a few images so that your concepts are clear about this intercostal muscle. So exactly, if you will see this image, can you appreciate? So let me slightly enlarge more. So yes, basically, can you appreciate the green color muscle is the external intercostal muscle, and we have got the yellow color muscle which is the internal intercostal muscle. So everybody, can you appreciate the direction of the muscle is tangential and perpendicular to each other. So if you will see the external intercostal muscle, its direction is traversing lower down and medially. Okay. And just opposite to it is the direction of internal intercostal muscle. The direction. So you can just appreciate this. The rib above, the rib below. This is the direction of the fibers of external intercostal muscle, and this is exactly internal intercostal muscle, and slightly we can say that innermost and internal intercostal muscle direction is corresponding to each other, but external intercostal muscle muscle fibers are direction just opposite or perpendicular to that of internal and innermost intercostal muscle. So here I just want you to show also the transversus thoracic muscle. When I'm talking about transversus thoracic muscle, what I want everybody to understand that transversus thoracic muscle is also consists of other muscles. It is consist of three muscles, and the name is innermost intercostal muscle. The name is innermost intercostal muscle, subcostal muscle and sternocostalis muscle. So here in this direction, innermost intercostal muscle we have already seen here, and here you can see this is the subcostal muscle and sternocostalis. So this is the subcostal muscle. Actually it is descending, connected to 3 ribs as shown here. And if you will see the sternocostalis muscle, actually it is attached to the sternum and then proceeding in upward direction. Done. This is also showing the sternocostalis muscle, and very nicely you can appreciate the sternocostalis muscle is attached to the posterior aspect of the sternum, and then it is traversing in upward direction to be attached to 2nd to 6th costal cartilages ribs, or the junction of cartilage and the ribs of these second, third, fourth, fifth, sixth ribs. So now let's talk about, so we have already talked, if I talk about intercostal space, it is containing intercostal muscle, intercostal vein, intercostal artery, intercostal nerves and intercostal lymph node. The next topic which everybody should understand is about intercostal nerves. So it's also important for you to understand what exactly intercostal nerves are. So intercostal nerves are formed by, the formation of intercostal nerve is by anterior primary rami of upper 11 thoracic spinal nerves. Okay. So intercostal nerve is formed by the anterior primary rami of the upper 11 thoracic spinal nerves. So this is the formation of intercostal nerves. Now we have got typical and atypical intercostal nerves, and it is very important for you to understand the concept of typical and atypical. Okay, so those who are live, I just want to interact. Any idea? Any idea? What do you understand by typical or atypical? You can definitely write your answers in the message box, because I want it to be a live session so that we can grasp more from this class. So what do you understand by typical and what do you understand by atypical nerves? So if you are having an idea of typical and atypical terms, you will understand this. Okay. So actually, whenever I am using the word typical, that means that typical nerve is located in its space. Okay. For example, I've taken example of a classroom where a bunch of students are residing. So typical students are those who are disciplined, who are like who are obeying all the orders, and they are confined in their space. They are not bunking the class. But atypical are one, they are like they bunk the class, they go here and there, and they are not confined to that rule and regulation. So they are atypical. The same goes with the typical nerve and atypical nerve. When I am talking about typical intercostal nerve, what does it means? That these typical nerves are confined in their intercostal space. Okay, they are not wandering here and there. What about the atypical ones? When I am talking about the atypical ones, it means they are not exactly confined in their intercostal space. They are wandering here and there. For example, why the first thoracic intercostal nerve is called as atypical? The reason is that it is wandering. It is not only confined to its thoracic region, it is wandering, and it is taking part in formation of brachial plexus. Okay, what is the formation of brachial plexus? C5, C6, C7, C8 and T1, ventral rami of these nerves. That T1 nerve is contributing in the formation of brachial plexus. Why the second one is atypical? The second thoracic spinal nerve is considered to be atypical, and the reason is that, why? The reason is that this is called as intercostobrachial nerve, and it is forming communication. It is forming communication with the medial cutaneous nerve of arm. Okay, so this is the reason the second intercostal nerve is also called as atypical. Now the next question which arises in your mind, why the 7, 8, 9, 10, 11 are atypical? They are atypical because they are not confined in the thoracic region, but they are going in the abdominal region, in the abdominal aspect, in the abdominal regions. They are giving innervation to the abdominal wall. So, my dear students, those who are live, have you understood the concept of typical and atypical? Please let me know. If you haven't understood, please tell me, I will repeat the thing. What is the reason that the T1 spinal nerve is atypical? What is the reason that T2 spinal nerve is atypical? What is the reason the 7, 8, 9, 10, 11 are atypical? If anyone is having any doubt, please write in the message. I will be very happy to explain it once more. And if it is okay, please write it. Give me a thumbs up for it. If you have understood, give me a thumbs up for it. Otherwise, you can write in the message that please ma'am repeat this, I haven't understood. Okay. Okay, baby. Okay, everyone, students. Any doubt, please let me know. So can we move further? The concept is cleared that only typical thoracic nerve, typical intercostal nerves are third, fourth, 5, 6. Other thoracic spinal nerves are atypical. Concept is clear. Anyone wants me to repeat, they can let me know. Now, ma'am, can you repeat please? Typical are limited to their intercostal and what are atypical, ma'am? So yes, I got a doubt from Vedant. Yes, Vedant. So once more for you, what I want everybody to understand, Vedant, please have attention once more. When I am telling that this nerve is atypical, the concept is that why it is termed as atypical, because they are wandering here and there. Okay, I will give you, Vedant, I will give you an example of classroom. Some students are typical. They will follow the rules and the regulation. They will obey what has been told by their teachers, and they will be confined in their lecture theater, and they will be listening to the class. But the atypical one will wandering here and there. Now, in this thoracic nerves, we know that anterior rami of thoracic nerves are intercostal nerves. Now, the first, second, 7, 8, 9, 10, 11 are atypical. They are not confined in the thoracic region in their intercostal space, but they wander here and there. Where they go? Why first one is atypical? Because I just want to write the first thoracic nerve. First thoracic nerve will form lower trunk of brachial plexus. What it will form? It will form or contribute in formation of BP, brachial plexus. We know that lower trunk of brachial plexus is, so we know that C5, C6, C7, C8 and T1. That means T1 is also taking part in formation of brachial plexus. Now, the second thoracic spinal nerve is atypical. The reason is that it will form intercostobrachial nerve. Intercostobrachial nerve. Now, intercostobrachial nerve. What do you understand by term intercostobrachial nerve? Actually, this will form communication with the medial cutaneous nerve of arm, and so it is atypical. Now, if I am talking about 7th, 8th, 9th, 10th and 11th thoracic nerves, they are also atypical. Thoracic nerve which is forming intercostal nerve, because they will go in the abdominal region. They will go in the abdomen region. That means this nerves are atypical because they are not confined in the thoracic region. They are going into the upper limb region. They are going in the, they are again intercostobrachial nerve is communicating with the upper limb also via medial cutaneous nerve of arm. So that is the reason they are called as atypical. Okay, Vedant, have you understood? Should I repeat it or it is okay? Precious, Tarun, Ranjit, Vedant, everybody, have you understood the concept of typical and atypical nerves? Okay, welcome dear. Now, there is a next image in which you can see the intercostal nerves has been shown, and you can see this intercostal nerve is actually, we know that intercostal nerves are formed from thoracic spinal nerves. So they will traverse in between the two muscles. So they are exactly traversing. Between the innermost and internal intercostal muscle, and they are ultimately giving branches which will be further we can see the branches of the nerves. We have got lateral intercostal nerves, we have got collateral branches, we have got anterior cutaneous branches, we have got muscular branches. These are the all branches given from the intercostal nerves. Okay. Now the next topic which everybody should understand is the intercostal arteries. Intercostal arteries. Now, it's important to understand intercostal arteries. So, exactly if I talk about intercostal arteries, we have got two intercostal arteries. We have got anterior and posterior intercostal arteries. Okay. So, we have got two intercostal arteries. One is posterior intercostal artery, and the other is anterior intercostal artery. Okay, so we have got posterior and we have got anterior intercostal arteries. So now, so these are anterior and posterior intercostal arteries are there. And you have to know, like for example, posterior intercostal arteries, we have got 11 pairs of posterior intercostal arteries, but in 9 intercostal space only we have got anterior intercostal arteries. So just in 9 spaces, we have got anterior intercostal arteries. We have got 2 pairs in the each side, so that means we have got 4 anterior intercostal arteries in each intercostal space. Now what is important for you is to know that posterior intercostal artery is a branch of which artery, anterior intercostal artery is a branch of which artery. Okay, so when we are talking about posterior intercostal arteries, we have got 11. We have got 11 pair of posterior intercostal artery. And it is also important that this is branch of which artery. So firstly, I would like to explain and then we'll write the details. So in this diagram, you can appreciate actually the first two posterior intercostal arteries. If I am talking about first two posterior intercostal arteries, that is first and second posterior intercostal arteries, these are branch of superior intercostal arteries, and superior intercostal artery is the branch of, if I talk about superior intercostal arteries, the superior intercostal arteries are the branch of costocervical trunk, and costocervical trunk is a branch of second part of subclavian artery. Rest 3rd to 11th, rest 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, all posterior intercostal arteries are the branch of descending thoracic aorta. They are branches of descending thoracic aorta. Directly the branch of descending thoracic aorta. So write down this. First and second posterior intercostal, first and second posterior intercostal arteries are branch of superior intercostal artery. And superior intercostal artery is a branch of, if I talk about superior intercostal artery, the superior intercostal artery is a branch of costocervical trunk, and costocervical trunk is a branch of second part of subclavian artery. Okay. Now 3rd to 11th posterior intercostal artery, 3rd to 11th posterior intercostal artery are directly branch of descending thoracic aorta. Descending thoracic aorta. Okay, they are directly the branch of descending thoracic aorta. Okay, dear. Now the next thing which I want everybody to understand, so the next thing which I want everybody to understand is the anterior intercostal arteries. Okay, so done with this, now we will move with the anterior intercostal arteries. Now for anterior intercostal artery also, firstly I will explain and then write the contents. So see here. So exactly this is internal thoracic artery, and if I talk about internal thoracic artery, so I just want everybody also to know the branches of posterior intercostal arteries. If you want, you can just write down also the branches of posterior intercostal arteries. So you can just write down here. Please write down the heading. Branches of posterior intercostal arteries. Branches of posterior intercostal arteries. Branches of posterior intercostal arteries. Okay, branches of posterior intercostal arteries. I would like everybody to write it. I want everyone to write this. Branches of posterior intercostal artery, and the important branches are, it gives muscular branches, it gives collateral branches, it gives dorsal branches, it gives mammary branches. So basically if I talk about mammary branches, these are actually given in following space. It is given in second, it is given in third, and it is given in fourth intercostal space, in fourth intercostal space, intercostal space. Costal space. Other branches which it gives, it also gives one of lateral cutaneous branch, and it gives right bronchial artery. So right bronchial artery, it gives right bronchial artery. Actually, it's very important to know that right bronchial artery is a branch of which artery, because right bronchial artery is a branch from third posterior intercostal artery. Right bronchial artery is a branch of third posterior intercostal artery. And it also gives lateral cutaneous branches. It also gives lateral cutaneous branches. So done. So these are all the branches of posterior intercostal arteries. These are all the branches of posterior intercostal arteries. And now we'll talk about, these are all branches of posterior intercostal artery. Now we will talk about anterior intercostal arteries. So if I am talking about, so please write on the heading anterior intercostal artery. So basically, if I am talking about anterior intercostal arteries, we have to know that anterior intercostal arteries are present. So it is important for you to note down that anterior intercostal arteries will be present only in Anterior intercostal arteries are present only in the upper 9 spaces. It is present only in upper 9 spaces. So, anterior intercostal artery is present only in upper 9 intercostal space. It is present only in upper 9 intercostal space. Now, if I talk about first 6 anterior intercostal arteries, if I am going to talk about the first 6 anterior intercostal arteries, the first 6 anterior intercostal arteries is the branch from directly the internal thoracic artery, and the rest of the branch from the terminal part of musculophrenic artery. So, firstly, let me explain because you can get confused. So, you can see the first 2, 3, 4, 5, 6. So, this first 6 anterior intercostal arteries are directly the branch of internal thoracic artery, but 7th, 8th, 9th anterior intercostal arteries are the branch of musculophrenic artery. So, what you can see, this is the image showing internal thoracic artery, and here you can appreciate that in the internal thoracic artery, first 6 anterior intercostal arteries are directly the branch of internal thoracic artery, but 7th, 8th, 9th are the branch of musculophrenic artery. 7th, 8th, 9th are the branch from the musculophrenic artery. Okay. 7th, 8th, 9th are the branch from the musculophrenic artery. Now, internal thoracic artery. Write down. Internal thoracic artery. So before that, so here I just want everybody to make a note. I will use a red color for it. Write down. First 6 anterior intercostal arteries. First 6 anterior intercostal arteries are branch from. First 6 anterior intercostal arteries are branch from internal thoracic artery. And internal thoracic is a branch from first part of subclavian artery. Now, 7th, 8th, 9th anterior intercostal arteries are branch from which structure? They are branch from the terminal branch of internal thoracic artery. They are branch from musculophrenic artery. So, they are branch from musculophrenic artery. So, this must be known to you. This is very important and should be known to you. Okay. Okay. So, before that, okay, internal thoracic artery. So, actually internal thoracic, just a introduction about the internal thoracic artery has to be given to you. Internal thoracic artery is a branch from the first part of subclavian artery, and it is descending behind the medial end of the clavicle and upper 6 costal cartilages. Okay, and it is lying approximately 1 centimeter away from the lateral margin, and it will be ending and terminating as 2 terminal branches, that is superior epigastric artery and musculophrenic artery. The important branches of internal thoracic artery are, it gives pericardiophrenich arteries as this branch, it gives mediastinal branch, it gives anterior intercostal artery as a branch, it gives perforating artery as a branch. Perforating artery is given in the intercostal space, that is the 2nd, 3rd and 4th, and it also gives terminal branches. It gives terminal branches, gives 2 terminal branches, that is musculophrenic artery and that of superior epigastric artery. So that is important for you to understand. So please write down about internal thoracic artery. Next topic is internal thoracic artery. Internal thoracic artery is a branch from first part of, it's a branch from first part of subclavian artery It's a branch from first part of subclavian artery. Yes, good morning, Osama. It descends behind medial end of clavicle and upper 6 costal cartilages, upper 6 costal cartilages 1 centimeter away from the lateral margin of, 1 centimeter away from the lateral margin of sternum and ends in 6th intercostal space and ends in the 6th intercostal space. So this is about, briefly about, what is this? This is the brief introduction about internal thoracic artery, and I would also like to tell you about the important branches of internal thoracic artery. So please highlight it. Okay, internal thoracic artery. Done. Now all of you please write down branches of internal. I just want you to show this image where you can have an idea. So let me just enlarge this. So actually you can see this is in subclavian artery, and you can see from the first part it is giving thyrocervical trunk as a branch. Costocervical trunk is a branch from second part, internal thoracic and vertebral artery. So all these and all these are the branches. So these are showing the branches, and here you can appreciate that, here you can appreciate very nicely, please rub this, and here you can appreciate that internal thoracic artery is a branch from the first part of the subclavian artery. Costocervical trunk will be a branch from the second part of subclavian artery. Okay, now here itself you can please write on the heading and write the details. Write down branches of internal thoracic artery. Branches of internal thoracic artery. You can just highlight this. Branches of internal thoracic artery. And what are the important branches? Write down the name. The branches are, the important branches given by internal thoracic artery is pericardiophrenik artery. Pericardiophrenik artery is given. Then we have got mediastinal branch. It also gives anterior intercostal arteries in the upper 6 spaces. It also gives anterior intercostal arteries in upper 6 intercostal spaces. Then it also gives perforating artery. It also gives perforating branches, that is in the second, third and fourth intercostal space. It also gives two terminal branches. So write down, it gives two terminal branches. It gives terminal branches. And what are the name of two terminal branches? It gives two terminal branches. The one is musculophrenic artery. The one is musculophrenic artery. And the other is superior epigastric artery. Superior epigastric artery. Musculophrenic artery and superior epigastric artery. Okay, so these are the branches of internal thoracic artery. The next important discussion is about intercostal vein. So that is also very important. So if I am talking about intercostal vein, I just want everybody to understand that intercostal vein, if I talk about anterior intercostal vein, it's just similar. The drainage is just similar. So if I am talking about anterior intercostal vein, its drainage is just similar to that of anterior intercostal arteries. What does that mean? That means that the first 6 anterior intercostal vein will drain into internal thoracic vein, and if I am talking about the 7th, 8th and 9th anterior intercostal vein, it will drain into musculophrenic vein. That means in a just a one line is enough that anterior intercostal vein is corresponding to anterior intercostal artery. So there is it's very easy to understand. But the thing, what goes wrong with the posterior intercostal vein is that the posterior, if I am talking about posterior intercostal vein, the drainage is different in the drainage is different in anterior, the drainage is different in the right part and in the left part. So that is not similar. So that is important for you to understand. Okay. If I am talking about the intercostal vein, posterior intercostal vein drainage, it is not similar on right and the left side, it is different on that side. So that has to be understood. Okay. So that means I would like firstly to tell you about the intercostal vein. I would like to tell you about intercostal vein and then I will like to explain it. Okay. So I just want everybody to see this image. Actually here you can see basically the posterior intercostal veins on the right side, most of it is draining into azygous vein, but the azygous vein mirror image is accessory hemiazygous and hemiazygous on the left side. So difference is there in the drainage of right and left side. So there is a clear picture, there is one schematic diagram which will help you to understand. So I just want everybody to see this image. Okay. So if you are seeing this image, you can understand the drainage differences in the right and the left side. So what you can see that this will be the right side. Please write down. This is right side and this is left side. Okay. Now what you can appreciate, the first, so what you can appreciate, the first right posterior intercostal vein is draining into right brachiocephalic vein and the first left is also draining into left brachiocephalic vein. That means the right and left side first posterior intercostal vein is draining into respective brachiocephalic vein. Now what happens? The second, third and fourth will together join. So you can say second, third and fourth will join to form superior intercostal vein, as you can see. And second, third and fourth superior intercostal vein on the left side is draining also into brachiocephalic vein as shown in this diagram. But in the right side, it is draining into azygous vein. In the right side, what you can say, it is draining into azygous vein. The 5th, 6th, 7th, 8th, 9th, 10th, 11th, all these right side posterior intercostal vein is also draining into azygous vein. But as we know, azygous vein mirror image on left side is hemiazygous and accessory hemiazygous. So upper superior part, that is 5th, 6th, 7th, 8th, 9th, left posterior intercostal vein is draining into accessory hemiazygous and 9th, 10th, 11th is draining into hemiazygous. 9, 10th, 11 is draining into hemiazygous. So the reason of difference of drainage in right and the left side is because The azygous vein is, the word azygous means alone, not having companion. It's have a mirror image in the left side. The upper mirror image is called as accessory hemiazygous vein. The lower mirror image is called as hemiazygous vein. Thus, upper 5th, 6th, 7th and 8th left posterior intercostal vein is draining into accessory hemiazygous, and 9th, 10th, 11th left posterior intercostal vein is draining into hemiazygous. You can also see the subcostal veins draining. So let's talk about this. So let's talk about posterior intercostal vein in detail. Then we will solve few MCQs also. So here you can say, write on the heading posterior intercostal veins. Now, just one point you can write here, intercostal veins. Anterior intercostal veins, anterior intercostal veins anterior intercostal veins drainages corresponding to anterior intercostal artery. That means it's just similar to the anterior intercostal artery, not much of difference, but difference lies in the posterior. So posterior intercostal veins drainages different on right and left side, is different on right and the left side, and that is where you have to pay attention, you have to understand that. So all the students who are live, I just want to tell, after finishing this topic we will have few MCQs discussion and then I will go with the next topic. Okay, so write on the heading. The heading will be posterior intercostal veins. Posterior intercostal veins, and one side you write right posterior intercostal veins, and other side you can write left posterior intercostal veins. Okay, now the first point is, so you can just write on the first point, right first posterior intercostal vein drains into right brachiocephalic vein, right brachiocephalic vein. Then write left first posterior intercostal vein drains into left brachiocephalic vein, left brachiocephalic vein. The second point is please write down second, third, fourth. Second, third and fourth, right posterior intercostal vein will join to form right superior intercostal vein, will join to form right superior intercostal vein and drains into a gyrus vein, Here, second, third, fourth, left posterior intercostal vein will join to form left superior intercostal vein and drain into left brachiocephalic vein. So this is the difference. That means right superior intercostal vein is draining into a gyrus vein, but when I am talking about the left hand side, the left superior intercostal vein is draining into left brachiocephalic vein. So that is the difference which is seen in the drainage of the intercostal vein on the right side and the left side. Now the next comes, okay, so done with this. Now the next comes. So you can just highlight this also so that there is no doubt. This is the right posterior intercostal vein. Okay. So now we will come to the third point and the fourth point. So please write down this further. Fifth, sixth, seventh, eighth, ninth, 10th, 11th, right posterior intercostal vein will drain into a gyrus vein. Now, fifth, sixth, seventh, eighth, left posterior intercostal vein will drain into accessory hemiazygous vein. Okay. Ninth, 10th and 11th left posterior intercostal vein drains into hemiazygous vein. So done with this. So this is the difference of the drainage. So we have done with the right and the left posterior intercostal vein, and we have written the difference of the drainage in the right and the left side. This is highly important. I have already shown you in the image also, and I hope it is understood to you. Now, before proceeding to the MCQs, I just want everyone to write one important point. Actually, muscles of respiration is important for you to note down. Now, muscles of respiration. So, exactly just a quick recapitulation I want to give, and then we can proceed for the MCQs. Muscles of respiration. See here. So, if I am talking about muscles of respiration, you have to understand primary inspiratory muscle. So, whenever I am using the word primary inspiratory muscle, so when I am using the word primary inspiratory muscle, the primary inspiratory muscles are external intercostal muscle, and the second diaphragm. So, basically diaphragm and external intercostal muscles are primary inspiratory muscle. So, we have also got accessory inspiratory muscle which will be active in deep respiration or forced respiration. So, we have got accessory muscles of inspiration. So, if I am talking about accessory muscles of respiration, so if we are talking about that, so if accessory muscles of respiration will be which are active in the forced or deep respiration. So, in that category, the primary will be there, primary inspiratory plus other muscles will be there. Other muscles are scalenus group of muscle. Other than that, we have got sternocleidomastoid muscle. Then we have got also serratus posterior superior muscle, serratus posterior superior muscle. Then we have got trapezius muscle, rhomboidus group of muscle. So, actually serratus anterior, serratus anterior. So, basically scalenus group of muscle I have written, yeah. So, many muscles are there of head and neck region and upper limb which is active, and they are considered as accessory muscle of inspiration. Here I want you to pay attention that serratus posterior superior is an muscle of inspiration, but serratus posterior inferior is a muscle of expiration. Now, here itself in this part, again you can write expiratory muscles, expiration. So, when I am talking about an expiration, you can write no muscles are active. It is a passive condition, and it is by the elastic recoil of the lung it happens. No muscles are active, no muscles are active. But in forced or deep respiration, deep respiration or forced respiration, expiratory muscles are, but in forced respiration or deep respiration, expiratory muscles are muscles of expiration are. So, in that you have got following list, and that list of muscles are quadratus lumborum muscle. We have got quadratus lumborum. We have got quadratus lumborum muscle. We have got internal intercostal muscle. We have got transverse thoracic muscle. We have got serratus posterior inferior muscle. Serratus posterior inferior muscle. Serratus posterior inferior muscle. So, actually these are, so here an important point which you have to note down is serratus posterior inferior is, when I am talking about serratus posterior inferior, it is a muscle of expiration, but when we are talking about serratus posterior superior, it is a muscle of inspiration. So that all point you have to note down. So you have to know the list of the muscles. So primarily if I talk about the muscle of respiration and muscle of inspiration is diaphragm and external intercostal muscle. But when there is forced or deep inspiration, it has to be taken. The accessory muscles are like the muscles of neck region, sternocleidomastoid. We will also have trapezius, rhomboidus group of muscle. We will have the other muscles like serratus posterior superior muscles. And when I am talking about expiration, expiration is a passive process and no muscles are active. But in case of forced expiration, we will have quadratus lumborum. The muscles which is active in that case, that is quadratus lumborum, internal intercostal muscle, transverse thoracic muscle, serratus posterior inferior. When I am talking about transverse thoracic, it means the muscles like sternocostalis, subcostalis, intercostal muscle intimi. So these are the muscles which will be active in the case of expiration. So transverse thoracic, we know that it is again made of three muscles: innermost intercostal muscle, subcostalis muscle, and that of sternocostalis muscle. So done with this. Now can we solve few MCQs along with you? Everyone, can we have a discussion of few MCQs? Now the first question is, all of you, I will give you few seconds to mark the right answer. So I will just give you few seconds to mark the right answer. So which posterior intercostal vein of left side drain into accessory hemiazygous? So question number 1, accessory hemiazygous. Which posterior intercostal vein of left side drains into accessory hemiazygous? Yes, dear, blessings. Yes, blessings. Watching from Nigeria. Okay, very good, great. It's really good that you are watching the session from Nigeria. So which posterior intercostal vein of left side drains into accessory hemiazygous vein? The right answer is, anyone else want to attempt? See here, I already written also 5th, 6th, 7th, 8th, 9th is draining into accessory hemiazygous. Is draining into accessory hemiazygous. I have written also, and I have shown you in the image also. So 5th, 6th, 7th, 8th, 9th. Accessory hemiazygous 5th, 6th, 7th, 8th. 5th, 6th, 7th, 8th. Okay. Now, which one is a branch? Which one is not a branch of internal thoracic artery? Which of the following artery is not a branch of internal thoracic artery? Which one is not a branch of internal thoracic artery? So, if you remember, I told you internal thoracic artery, two terminal branches are superior epigastric and musculophrenic artery. So, these two are terminal branches of internal thoracic artery. Anterior intercostal and posterior intercostal arteries are there. So also upper 6 spaces anterior intercostal arteries are the branch from the internal thoracic artery. So if I am talking about the posterior intercostal arteries, I already told you posterior intercostal arteries are the branch of superior intercostal, that is costocervical trunk in first 2 spaces, and rest all are from 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, all are directly the branch of descending thoracic aorta. So the right answer will be, D. This posterior intercostal arteries. So the right answer will be D. Posterior intercostal arteries are clear. Yeah. So posterior intercostal arteries are the branch from, so if I am talking about this, are branch from costocervical trunk and descending thoracic aorta. Okay. Now question number 3. The order of structure in upper part of intercostal space as you proceed from above to down. The order of structures in the upper part of intercostal space as you proceed from up to down. Vein, artery, nerve, artery, vein, nerve, artery, vein, nerve, artery, vein. So the order is vein, artery and nerve. Van, as I told you, van is the answer, and it is between innermost and internal. It is between the innermost intercostal muscle and internal intercostal muscles. So that is the right answer will be intercostal vein, then we will have the intercostal arteries, and then we will have the intercostal nerves. So right answer is A. So part of transverse thoracic muscles are all except which is not a part of transverse thoracic muscle. Which of the following among subcostalis, intercostalis intimi, sternocostalis, serratus posterior superior. So they have got 4 muscle and you have to tell that part of transverse thoracic muscles are all except. So if we are talking about transverse thoracic muscles, so it is important for us to note down that so if I am talking about transverse thoracic muscle, it is important for us to note down that transverse thoracic muscle is made of 3 muscle. We have got sternocostalis, subcostalis, and innermost intercostalis muscle, which is also called as intercostalis intimi. So the right answer will be serratus posterior superior muscle. Which will be the right answer? D will be the right answer. Now, which of the following arteries are enlarged in case of coarctation of aorta? So, if there is a condition of coarctation of aorta, which of the following arteries are enlarged? Which of the following arteries are enlarged in coarctation of aorta? Subclavian, internal mammary, posterior intercostal, or anterior intercostal? The right answer will be posterior intercostal artery. Posterior intercostal arteries are enlarged and this will cause rib notching. This posterior intercostal will enlarge and will lead to case of rib notching in coarctation of aorta. No, subclavian artery I told you in the thoracic syndrome. It was compressed by in the. Now, can we start next topic, mediastinum, everyone? Let's start with the next topic, mediastinum. So exactly if I talk about the mediastinum topic, why it is important, I will tell you. Mediastinum, the reason why mediastinum is important, I will tell you, because mediastinum topic questions has been asked several times in the examination. So several times in the FMG examination, the question has been asked from the topic of mediastinum. So that is the reason you should know mediastinum in detail. So actually, I would like to give you the concept of mediastinum. What exactly we mean by the word mediastinum? What is the area which is exactly the mediastinum area, and it is divided into different parts. So that is important. So see here. So I just want you to show this image where you can see actually. So actually, in I just want to firstly define mediastinum. So when I am talking about mediastinum, you have to understand that mediastinum is a part which is lying between the two side pleuras of the lung. So we know that if I am talking about pleuras of the lung, so we know that lung is covered by the pleura, which is having medial part, mediastinal part is the mediastinal pleura. Lateral aspect we will have the costal pleura. Superior aspect of the lung is covered by cervical pleura. So exactly what happens, the two side medial aspect of the lung covered by mediastinal pleura, the space lying between is the mediastinum. So if I just want to tell you about the boundaries of mediastinum, superiorly there will be superior thoracic aperture. So first I would like to explain this. So this is the plane of superior thoracic. So this is the plane of, okay. So this is exactly the plane of superior thoracic inlet. So this is exactly the plane of superior thoracic inlet. Okay, this is the plane of superior thoracic inlet which is forming the superior boundary, as you can see. Okay, this is forming the superior boundary. Okay, so this is exactly forming the superior boundary of superior thoracic aperture. Inferiorly, if you will see, if I talk about inferior aspect, there is a diaphragm. So inferiorly it is bounded by which structure? Inferiorly it is bounded by diaphragm. So inferiorly we have got a diaphragm, superiorly we have got superior thoracic aperture. In front it is bounded by manubrium sternum, the sternum bone, and behind it is bounded by the thoracic. Behind it is, if I talk about the behind aspect, so behind we have got the thoracic part of vertebral column. So behind it is bounded by thoracic part of vertebral column. So this is the overall boundary. This is the overall boundaries of mediastinum. So this is how the mediastinum is bounded. So if you want to just know about mediastinum, you have to know superior boundary, superior thoracic aperture, inferiorly bounded by diaphragm, and on either side there is mediastinal pleura. Anteriorly there is sternum and posteriorly there is thoracic vertebral column. Now we will divide this mediastinum into 4 parts. So I just want to show you another image, so where I am just enlarging this. So in this diagram you can understand. Okay, so in this diagram I will draw an imaginary line. So just to make you understand, an imaginary line, and this imaginary line or plane is passing, anteriorly from the angle of Lewis. What do you mean by angle of Lewis? That is the sternum, that is the manubrosternal angle. The junction of the manubrum part of the sternum and the body part of the sternum is called as angle of Lewis. So the junction of manubrum sterni and the body of sternum is called as angle of Lewis, and posteriorly it is corresponding to T4 to T5 thoracic vertebra. So posteriorly it is corresponding to T4 and T5 thoracic vertebra, intervertebral disc, and the space which is lying above it, it is called as superior thoracic, superior mediastinum. So the part of mediastinum which is lying above this plane is called as superior mediastinum. What is it called as? It is called as superior mediastinum. Okay, and the part below this is called as inferior mediastinum. Again, the inferior mediastinum is divided into 3 parts. Okay, 3 parts. Now the part which is lying behind the manubrum sterni and that of anterior to the pericardium of the heart, this is called as anterior mediastinum. This part is called as anterior mediastinum. Okay, now the part which is containing heart and the pericardium, and its great vessel is called as the middle mediastinum. This part is called as the middle mediastinum. This part is called as the middle mediastinum. And the part lying posterior to it, and the part which is lying posterior to middle mediastinum and in front of the vertebral column, that is called as posterior mediastinum. The part which is lying in front of the vertebral column, this part is called as posterior mediastinum. So this is called as posterior mediastinum. So this is how the overall mediastinum is divided into 4 parts. So everyone, I am just enlarging it. Have you got the concept of division of mediastinum into 4 parts? So firstly, I have given you the concept of what is mediastinum. Then I have given you the concept of how mediastinum is divided into 4 parts. That is superior, middle, anterior, posterior mediastinum. Now we will know about the contents of each part of the mediastinum. So I just want everyone. Okay, here also this is a radiological image where you can see this is an imaginary plane which is passing from angle of Lewis and T4 and T5 thoracic vertebra. This will be the area above it. If I am talking about the area above it, this is the superior mediastinum. The area, this is anterior mediastinum, posterior to the sternum, anterior to the heart. We have got this structure as the middle mediastinum, heart and its great vessels, and we have got posterior to the heart and anterior to vertebral column, P as the posterior mediastinum. So here A for anterior mediastinum. So in this term you can clearly understand here mediastinum, boundaries of mediastinum, write on the heading. Boundaries of mediastinum. Boundaries of mediastinum. So the boundaries of mediastinum is that superiorly it is bounded by superior thoracic aperture, inferiorly by diaphragm, on each side it is bounded by mediastinal pleura. Yes, Osama, mediastinal pleura, posteriorly by thoracic vertebral column, and anteriorly by sternum, anteriorly by sternum. Anteriorly by sternum. The next important point which you should know is the division of mediastinum. The next important point which must be known to you is the division of mediastinum. So here you can write division of mediastinum. Write on the heading. Yeah. Division of mediastinum. So just a minute. Division of mediastinum. Division of mediastinum. Division of mediastinum. So division of mediastinum by an imaginary plane passing anteriorly through angle of Lewis, which is manubrosternal angle, and posteriorly it passes through T4, T5 thoracic vertebra. Mediastinum is divided into superior mediastinum and it is divided into inferior mediastinum. Okay. Now inferior mediastinum is further divided into 3 mediastinums. What is it? So this is how the mediastinum and inferior is divided into. The inferior is divided into anterior mediastinum, middle mediastinum and posterior mediastinum. So this is how the mediastinum is divided into following parts. So this is the topic of division of mediastinum. So this is how the whole mediastinum is divided into how many parts? Into 4 mediastinum. One is the inferior mediastinum, then is the superior mediastinum, then is the anterior, middle and posterior mediastinum. Done. We have done with this. Now the next important thing which is highly important for you to understand is the content of individual parts of the mediastinum. So you have to know the contents of superior mediastinum, you have to know the contents of middle mediastinum and you have to know the contents of posterior mediastinum, middle. So see here, in this diagram we can see the contents of superior mediastinum. So important contents are, if you will see this diagram, the important contents are, you can see the arch of aorta and its branches. So this is arch of aorta which I am showing you with red color highlighting it. This is the arch of aorta with its 3 branches. and these three branches is left subclavian artery, left common carotid artery, brachiocephalic artery. Which is it? Brachiocephalic artery. So these are the three branches. Arch of aorta and its three branches are the content of superior mediastinum. Then we have also got the veins. So we have got vena cava. So we have got left brachiocephalic vein as the content, left superior intercostal vein. So we have got left superior intercostal, we have got left brachiocephalic and superior vena cava. So please note down, right is not, we have got mainly, okay, right and left brachiocephalic, but we have got no, only left superior intercostal vein. So we have got right and the left brachiocephalic vein. Got the content? So these are all the contents which I am highlighting. Other than that, trachea and esophagus is the content. We have got trachea, we have got the esophagus. So we have got trachea and we have got the esophagus as the content. Other than that, we have got few nerves as the content. And what are these nerves? These nerves are left recurrent laryngeal nerve, we have got left vagus, we have got also the sympathetic chain and the vagus nerve. So these are all the contents of superior mediastinum which has been shown, and I just want everybody to note down the list of the structure contents of the superior mediastinum. So please write down the contents of superior mediastinum. So please write down contents of superior mediastinum. So the content of superior mediastinum is, firstly we will write down the first content, that is arteries. Arteries. The important arteries as the content are arch of aorta, arch of aorta and its branches, arch of aorta and its branches. So first is arch of aorta and its branches. By its branches, I would also like to write down the name of its three branches: left subclavian, left common carotid artery, and brachiocephalic trunk. So please write down. The content is left subclavian artery, left common carotid artery, left common carotid artery, and that of brachiocephalic trunk, and that of brachiocephalic trunk. So all these are the contents of superior mediastinum. These all arteries are the content of superior mediastinum. So done. Now coming to the veins, the important veins. So write down the important veins as the content. The important veins are right and the left brachiocephalic vein, right and left brachiocephalic vein, then we have got upper half of superior vena cava as the content, and also the left superior intercostal vein, also left superior intercostal vein, left superior intercostal vein. So these are the contents of superior mediastinum. So we have written the arteries, we have written the veins. What are the next? After mediastinum also we will have an MCQs. I just want everybody, after each and every topic I have given the MCQs discussion. Okay. So we have finished till now the two topics: thoracic wall, substance fascia, suprapleural membrane, and also intercostal space, and then we have solved the MCQ related to the topic. Now the next, then we have also completed intercostal spaces and its content and MCQs. Now the next topic is mediastinum, and here in the mediastinum again we will have the whole content and then I will discuss the MCQs related to the topic. So we have got right and the left brachiocephalic vein, upper half of superior vena cava, left superior intercostal vein. Now write down the nerves. The next is nerves. The important nerves as the content are phrenic nerve, we have got the phrenic nerve, and we have got the vagus nerve of both the side as the content, vagus nerve. We have got sympathetic chain as the contents, and we have got cardiac nerve plexus as the contents. So when I am using phrenic nerve, that means right and the left phrenic nerve, right and the left vagus nerve, we have got right and the left sympathetic chain, and we have got only left recurrent laryngeal nerve. Only left recurrent laryngeal nerve. So these are the nerves. Now talking about, so here also you can see the level of sternal angle and plane, and all the arteries and the veins has been shown. So important contents of superior mediastinum, the arch of aorta and its branches and the veins, superior vena cava, brachiocephalic veins are all the contents along with superior intercostal veins. Now I would like to move on with more content. So we have finished the arteries, veins and the nerves. We have got lymphoid structures, tubes and the muscles also as the content. So please write down. The fourth content is the lymphoid organ. Lymphoid organs, and the important lymphoid organs as the content are lymph nodes, the thoracic duct, and the content are thymus gland. Then we have got the other contents like muscles, the muscles content are, the important muscles as the content are, we have got three muscle as the content of superior mediastinum. We have got sternohyoid, sternothyroid and that of longus colli muscle. So we have got sternohyoid, we have got sternothyroid as the content, and we have got longus colli muscle as the content. So these are the three muscle as the content, and we have got also the last content list will be the two tubes. So two tubes are also the content, and by the tubes I mean to speak about the two tubes, that is the esophagus and the trachea. So we have got esophagus and trachea as the content. Okay, so done with this. So we have finished with entire list of the content of superior mediastinum. These are all the contents of superior mediastinum, and I hope all the list must be written by you, because I will solve MCQs related to this mediastinum after completing this. So before starting with anterior mediastinum, I just want everyone to see this transverse section. So when you see this transverse section, you are able to now understand the contents as you proceed from anterior to posterior. So here how you are going to know which is the posterior part. So see here, if you see the transverse section, you can see this is the thoracic vertebra. So we know that thoracic vertebrae will lie posterior, and we will have the sternum as anterior. So this is quite clear that this will be posterior part and this will be the anterior part. Now the contents are, for example, you can see the muscles as the content. So anteriorly we have got two muscles, sternohyoid, sternothyroid, and posteriorly we have got the longus colli muscle. So these are the muscles as the content. Longus colli muscle, sternohyoid, sternothyroid muscle as the content. Then we have got the brachiocephalic veins. So we can just, we have got the brachiocephalic veins as the content. We have also got the arch of aorta and its branches. We have got the, its three branches, the arch of aorta, left subclavian, left common carotid, brachiocephalic, and also we have got the nerves which is shown. So the nerves are there. We have got right, left phrenic nerve and vagus nerve and recurrent laryngeal nerve. So we have got all these nerves as the content, right vagus, left vagus, phrenic and sympathetic. We have got also the two tubes, esophagus and trachea. We have got the thoracic duct. So basically you can say many important structures, thymus gland is also there. So many important structures are forming the content. So we can also see the thymus gland anteriorly. So many of this structure as the content, and you can actually see the sequence of the content as you proceed from anterior to posterior. This is a schematic diagram of transverse section of the thoracic of the superior mediastinum, where you can see the content of superior mediastinum as you proceed from anterior to posterior. So how we are going to know which is the posterior part? By seeing the vertebral column, and an anterior part by seeing the sternum. And then we can see the plane and the structures arranged. So just posterior to the sternum we will have the muscle attached to the sternum, then we will have the thymus gland, then we will have the thymus gland, and then we will have the other structures like veins and the arteries and intervening nerves and the tubes, trachea posterior to esophagus and the longus colli muscle posteriorly and sympathetic trunk posteriorly. Now let's write on the contents of anterior mediastinum. Now we are going into the details of which mediastinum? Anterior mediastinum. Anterior mediastinum is the part of the mediastinum which is lying posterior to the manubrium sterni, which is lying posterior to sternum, and anterior to the middle mediastinum. That means anterior to the pericardium and its great vessels. Okay. So content of anterior mediastinum are, it contains, contents of anterior mediastinum are, it contains loose areolar tissue, it contains superior and inferior, it contains superior and inferior sternopericardial ligament, sternopericardial ligament. So exactly if I talk about superior and inferior sternopericardial ligaments, actually these are the ligaments which is stretching between, these ligaments are stretching between the sternum and that of the pericardium. So these are the ligaments stretching between the sternum and the pericardium. The other contents are lymph nodes, few lymph nodes of the anterior mediastinum, and also we have got mediastinal branch of internal thoracic artery as the content, and we have got the lower part of thymus gland as the content. So we'll write these two contents also. So proceeding with the list, two more contents are there. We have got mediastinal branches of internal thoracic artery as the content. Mediastinal branches of internal thoracic artery as the content. And we have got lower part of thymus gland. So actually here I want you to pay attention to the point. Actually you must be confused that thymus gland is a content of superior mediastinum also and the anterior mediastinum. What you have to understand is that upper part of thymus gland is a content, superior part of thymus gland is a content of superior mediastinum, and the lower part of thymus gland is a content of anterior mediastinum. Is it clear, everyone? Are you understanding? Superior part of thymus gland is a content of superior mediastinum and lower part of thymus gland is a content of anterior mediastinum. Now we will talk about the contents of middle mediastinum. So the content of middle mediastinum, just see this image. So for understanding the content of middle mediastinum, what I want you to understand here is that basically the content of middle mediastinum will be the heart and its pericardium covering along with its great vessels and bifurcation of trachea. So actually these are the important contents of the middle mediastinum. So please write down. So you can see the pericardium covering here. The dotted line is the pericardium covering along with the great vessels emerging out from the heart, which is all the content. So please write on the content of middle mediastinum. The contents are heart, the content is pericardium covering the heart. We have got arteries as the content, and all the arteries which is forming the content are ascending aorta as the content, pulmonary trunk. So actually pulmonary trunk emerging out and dividing into pulmonary arteries. Also the other content is pericardiophrenik artery. Pericardiophrenik artery. The contents are pericardiophrenik artery. Other than that, we have got few nerves as the content and veins as the content and the lymph nodes as the content of middle media. So these are three primary contents which we have written. Continuing with the list. The superior vena cava. So actually here also superior vena cava, lower half, because upper half is the content of superior mediastinum. The azygous vein, terminal part, azygous vein, in bracket you can write terminal part. The pulmonary veins, that is the right and the left, the right and the left. The nerves. So the nerves are, if I just want to write on the name of nerves as the content, so we have got the nerves, and the nerves as the content is phrenic nerve, deep cardiac plexus. The lymph nodes, that is tracheobronchial lymph nodes. Tracheobronchial lymph nodes and the tubes. Other content is the tubes. That is bifurcation of trachea. Bifurcation of trachea into right and the left, the principal bronchus. So the bifurcation of trachea is also the content of middle mediastinum into right and left principal bronchus. Right and the left principal bronchus. So basically all these are the contents. So basically we have written all the contents. These are all the contents which I have written for the middle mediastinum. So bifurcation of trachea into right and left principal bronchus, superior vena cava lower part, azygous vein terminal part, pulmonary vein, nerves like phrenic nerves, the deep cardiac plexus, and also we have got the tracheobronchial lymph nodes. So, so all these are the contents of the middle mediastinum. The next is the contents of posterior mediastinum. So here there is an image for showing the important contents of the posterior mediastinum. So we have got the esophagus as the content. We have got the in the posterior mediastinum we have got the esophagus. because it lies posterior. We have got descending thoracic aorta, not the arch of aorta. We will have the descending thoracic aorta. We will have the esophagus as the content, so we can write it posteriorly. We will also have the tracheo. We have got posterior mediastinal lymph node. We have got azygous vein as the content, or we will have the vagus nerve as the content. We will have thoracic duct as the content. So all these are the contents of posterior mediastinum. Posterior mediastinum is the space which is lying posterior to the heart pericardium and anterior to the vertebral column. So write down contents of posterior mediastinum. The contents of posterior mediastinum is following. Esophagus, descending thoracic aorta and its branches, descending thoracic aorta and its branches, thoracic duct, azygous veins. So azygous venous system, so we have got content as azygous, hemiazygous and accessory hemiazygous as the vein. Accessory hemiazygous veins as the contents. Other than that, we have got vagus nerves as the content, and we have got sympathetic trunk along with the splanchnic nerves. Sympathetic trunks along with the splanchnic nerves. We will have posterior mediastinal lymph node as also as a content. Posterior mediastinal lymph node as a content. So these are the contents. These are all the contents of posterior mediastinum which you have to know. These are all the contents of posterior mediastinum which you have to know. So by this we have finished with the topic of mediastinum and we are knowing all the contents of the mediastinum. What else we have to know? We have to solve few MCQs related to this topic and then we can proceed to the next topic, that is pericardium and the heart. So let's talk, can we solve the MCQs? Everyone, are you ready for it? Before that, if any of the student is having any doubt, please let me know. If any of the student is having any doubt, please let me know. Okay, if you, so let's start. Can we start? Okay, let's start with the MCQs related to the topic. Okay. So boundaries of mediastinum is all except. All of the following is forming the boundary of mediastinum except. Boundaries of mediastinum are all except. Sternum is there, cervical vertebra is there, thoracic inlet is there, diaphragm is there. So all of the following is forming the boundary of mediastinum except. Boundaries of mediastinum is all except sternum, cervical vertebra, thoracic inlet and diaphragm. So I got an answer. One of the answer is coming from Blessings. Okay, what about others? Osama has also given the answer. Blessing has also given the answer. Prajwal has also given the answer, and all of you are absolutely correct. So thumbs up goes for everyone. Thumbs up goes for everyone. Yes, absolutely right. Okay. Okay, so absolutely correct answer. Cervical vertebra is not forming the boundary of mediastinum. It's the thoracic vertebra which forms the mediastinum boundary, not the cervical vertebra. Absolutely correct. Now coming to the next one, content of middle mediastinum is all except. Content of middle mediastinum are all except heart with the pericardium, pulmonary arteries, upper half of superior vena cava, bifurcation of trachea. So Karthi S has given the answer. What about others? Yes, you are absolutely right. Upper half of superior vena cava. So can you tell me this upper half of superior vena cava is a content of which mediastinum? So upper half of superior vena cava, my question is, if it is not the content of middle mediastinum, can you tell me upper half of superior vena cava is the content of which mediastinum? So all of you are absolutely right. Now can you tell me? Yes, absolutely correct. Yes, blessings, you are also correct. Now my question is, yes, that if it is not the content of middle mediastinum, upper half of superior vena cava is not the content of middle mediastinum. So upper half of superior vena cava is the content of which mediastinum? And the right answer is upper half of superior vena cava is the content of which mediastinum? Just waiting for few seconds. Please give the right answer. Yes, it thumbs up goes for Prajvai. Absolutely correct, dear. Absolutely correct. Absolutely correct. Blessings. Absolutely correct. Yes, absolutely correct. Absolutely correct. Yes, it is a content of superior mediastinum. Done. Now, which one of the following is not a content of superior mediastinum? The options are arch of aorta, trachea, lower half of superior vena cava, or esophagus. Which of the following is not a content of C, lower half of superior vena cava? Those who have given me the right answer, that is lower half of superior vena cava, all those, more of everyone I think has given absolutely right answer, and everyone is right. Yes, lower half of superior vena cava is not the content. It's not the content. It is going into the middle mediastinum. So basically it is the right answer. Absolutely correct. We have just now, so if I talk about middle mediastinum, then the lower half of superior vena cava is the content. No, dear, A is not the right answer. See here, in posterior media, I will show you the list. Posterior mediastinum, azygous vein, hemiazygous, accessory hemiazygous is the content, but not the arch, dear. Otherwise, descending thoracic aorta, esophagus, thoracic duct, vagus nerve, all are the content. So, if I have to choose one of the answer, can you tell me now the right answer? I have given you the hint. Now tell me the right answer, which is not the content of posterior mediastinum. Now tell me the right answer. Give it a try. One more try. Blessings. Okay, yes. A, C, B, D. Okay, I have written like this. Yes. Arch of venous azygos is absolutely right. Yes, arch of venous azygos is absolutely right answer. It is the azygos veins which is the content, but not the arch. So basically that is the right answer. Now everyone has got the right answer. Yes, absolutely right. Absolutely right. Now can we start with the next topic? Pericardium and the heart. So firstly, actually heart is a big topic. So what I will do, I will first explain the heart outer aspect and the pericardium, and then we will move on into the interior of the heart, coronary arteries and all. So it's a big topic, and it has to be studied in detail. So we will start firstly from the outer aspect. Okay, pericardium. So what is pericardium? When I am talking about the word pericardium, what does that mean? That means that the heart is having a protective covering. Pericardium is a fibroserous sac which is enclosing the heart and its great vessels. So pericardium is exactly a fibroserous sac enclosing the heart and its great vessels. So we have got a covering of the heart. As we proceed from outside to inside, we have got fibrous pericardium. Then we have got a serous pericardium, which is again formed from the parietal and the visceral pericardium. So serous pericardium is made of parietal pericardium and the visceral pericardium, and in between the visceral and that of the parietal pericardium, the space is called pericardial cavity, which is containing approximately 50 ml of pericardial fluid, which is important for lubrication of the heart. So basically, if you proceed from outside to inside, the layers of pericardium will be, outermost is the fibrous pericardium, then we will have the serous pericardium, that is having parietal and visceral layer of pericardium. And you can see here in this diagram, the pericardial fluid is exactly between parietal and visceral pericardium. Pericardium. Pericardium is a fibroserous sac enclosing heart and its great vessels. From outside to inside, layers of pericardium. From outside to inside, the layers of pericardium is following. So from outside to inside, the outermost layer is fibrous pericardium. Then we have got the serous pericardium, which is again formed of two layers, that is the visceral and parietal pericardium. That is the visceral and parietal pericardium. That is the visceral and that of parietal pericardium. Okay, done. Now I just want you to show the cadaveric image. So what is this? Let me just enlarge this. So if I am enlarging it, you can see exactly the fibrous pericardium has shown to you. So we will have the fibrous pericardium as the outermost, and you can see the phrenic nerves running over it, protective covering of the heart, and you can see there the pericardium, fibrous pericardium is cut, and when it is cut out, these are the cut ends of the fibrous pericardium which has been shown, and when it is cut out, inside we can see the serous pericardium. The serous pericardium again is made of the parietal and the visceral layer of pericardium. Okay. So now I just want you to give the details of sinuses of pericardium. Write on the heading. Sinuses of pericardium. Sinuses of pericardium. So sinuses of pericardium, if I talk about, we have got followings. They are, so basically you have to know what is sinuses means recesses. Actually, if you want to know how it is formed, so they are formed due to reflection of visceral layer of serous pericardium around great vessels. So they are formed due to reflections of visceral layer of serous pericardium around the great vessels. So write down. They are formed due to reflections of visceral layer of serous pericardium around great vessels, around the great vessels. Around the great vessels. Now, actually, this reflections of the visceral pericardium leads to the formation of two sinuses, and and forms two sinuses. So that means two pericardial sinuses, and they are, what is it named as? They are, the first one is transverse sinus and the other is oblique sinus. Oblique sinus. Okay, transverse and oblique sinus. So one by one we will talk about each. So let's firstly talk about transverse and then oblique sinus. Transverse sinus is a recessus behind, it's a recessus behind ascending aorta. It is a recessus beside ascending aorta, pulmonary trunk, and in front of superior vena cava and superior pulmonary vein and superior pulmonary veins. The reason of formation of transverse sinus is transverse sinus develops due to degeneration of dorsal mesocardium. So if I talk about transverse sinus formation, the transverse sinus is formed due to degeneration of dorsal mesocardium. This is the first point. The reason of formation of transverse sinus is transverse sinus develops due to degeneration of dorsal mesocardium. Due to degeneration of dorsal mesocardium. So here one more important point is to note down. Here you can see, if I will use yellow color. So you can see this is the location of transverse sinus. Okay, this is the location of transverse sinus, and basically if you will see this, you can see this transverse sinus is lying between the arterial end. So there is an arterial end and posterior to it is the vein. So exactly transverse sinus is lying between the in between the arterial and the venous end of the heart, and you can see this will be an oblique sinus. One more sinus will be there, this will be oblique sinus. So oblique sinus is formed due to the four pulmonary veins absorbed into the two vena cavas and four pulmonary veins absorbed into the left atrium. So one more image is there, can you see here? So exactly this is showing you the location of transverse sinus, and this is showing you the location of oblique sinus. So you can see oblique sinus is formed by the four pulmonary veins or veins being absorbed, and transverse sinus is between ascending aorta and pulmonary trunk in front and vena cava posterior. So transverse sinus is it's a sinus of the recessus of the pericardium, which is located in between the arterial end of the heart, consists of pulmonary trunk and the ascending aorta, and the vena cava lying posterior to it. If I talk about oblique sinus, it is a recessus found in the base of the heart in the left atrium, enclosed by 6 veins, 2 vena cava and 4 pulmonary veins. So please write down. So here you can write down oblique sinus. Oblique sinus, it is a recessus located behind the base of the heart, behind in the base of heart, and base of the heart is formed by left atrium, enclosing the oblique sinus. So what is it doing? Enclosing 6 veins, the 2 vena cavas and the 4 pulmonary veins Okay, so done with this. Now I would also like to tell about the arterial supply and all. So basically, this is again a diagram where you can see the reflection of OS means oblique sinus. We can see TS means transverse sinus, and we can see transverse sinus is lying in between the arterial end and the venous end of the heart. And we will know about the arterial supply. Fibrous pericardium and parietal pericardium will have same arterial supply like that of branches of internal thoracic artery, musculophrenic artery, descending thoracic artery. And if I talk about the arterial supply of the visceral layer, it will be similar to the coronary arteries. If I talk about so other than that, if I talk about nerves, phrenic nerves will give innervation to that of pericardium, fibrous and parietal, and visceral will be having same nerve supply as the heart, that is vagus nerve, sympathetics, and by cardiac plexus. So write down here one more point you can write down. Transverse sinus is located between arterial and venous end of the heart, Now arterial supply of pericardium. Arterial supply of pericardium. Fibrous pericardium and parietal layer of visceral pericardium is supplied by branches of internal thoracic artery, musculophrenic artery, and descending thoracic aorta. So this is about the arterial supply of pericardium. Of the fibrous and parietal. What about the arterial supply of the visceral layer of pericardium? So then the second point is visceral pericardium is supplied by coronary arteries. Visceral pericardium is supplied by coronary arteries. Now coming to the nerve supply. Write down fibrous. Just a minute. Yes. Okay. Fibrous pericardium and fibrous pericardium and parietal pericardium is supplied by phrenic nerve. This is the first point. Here write down visceral. What about the visceral? If I talk about the visceral pericardium, it will have the innervation same as the heart. So it will have the innervation same as the heart. So write down visceral pericardium. Visceral pericardium is innervated by sympathetic chain branches, sympathetic nerves, and that of via vagus nerve. So actually it is via the cardiac plexus. So basically if I talk about the visceral layer of pericardium, its innervation will be same as the heart. So it is via cardiac plexus. Now talking about the next topic, external aspect, I just want you to tell about external aspect. So let's talk about external aspect, few important points, and thereafter we can have an MCQs, and then we will come to the interior of the heart. So exactly, okay, so no worries, we will have the external aspect. So when we are talking about the external aspect of the heart, so this is showing you the heart from the external aspect. So if you will see the heart from the external aspect, what you can see that this is the left ventricle which will form the apex, and the apex of the heart is directed in lower direction, and it lies in the fifth intercostal space, 9 centimeter from the 9 centimeters from the mid clavicular line, and just 9 centimeters from the midline, and just medial to mid clavicular line. So it is located just medial to mid clavicular line, 9 centimeters from the midline and medial to mid clavicular line. It is directed downward and forward and to the left. And if I talk about the base will be posterior to the apex. So left ventricle is forming, this is the apex. And if you see the posterior aspect, this is the left atrium along with a part of right atrium. This is basically forming the base. So base of the heart is just, base means posterior aspect of the heart, and it will be lying posterior to the heart, apex of the heart. So apex of the heart is lying in left fifth intercostal space, 9 centimeters from the midline and just medial to mid clavicular line. Base is formed by, is just opposite to the heart, and it is exactly formed mainly by the left atrium and part of right atrium, and it is corresponding to T5, T6, T7, T8 thoracic vertebra in the supine position, and when the person is erect, it descends one thoracic vertebra. It corresponds to T6, T7, T8 and T9 thoracic vertebra. So let's write firstly about the apex and the heart. So heart is, so firstly write down apex of the heart. Apex of the heart is directed downwards, forwards and to the left. Apex of the heart. So apex of the heart, it is located, apex of the heart, it is located in left fifth intercostal space, in the left fifth intercostal space, 9 centimeters from the midline and just medial to mid clavicular line, just medial to mid clavicular line, just medial to mid clavicular line. This is about the apex of the heart. Now talking about the base of the heart. Base of the heart is formed mainly by left atrium. It is basically mainly formed by the left atrium. Base of the heart is mainly formed by the left atrium. And partly by right atrium. In supine position or in cadaveric in supine position, base is corresponding to which thoracic vertebra? T5 to T8 thoracic vertebra. And in erect position, base of the heart is corresponding to T6 to T9 thoracic vertebra. T6 to T9 thoracic vertebra. And the location of base of the heart, which is the posterior surface of the heart, is just posterior. It is just lying posterior to that of the apex of the heart. So done. So we have done with this. Now I just want, like in case of the heart, so if I talk about the heart, heart is having apex, heart is having base, heart is having surfaces and the borders. So if I talk about the surfaces of the heart, so we will have anterior surface or sternocostal surface. So as sternocostal surface or anterior surface, if I am talking about, it is formed by right atrium, right ventricle mainly, and basically in right atrium and right ventricle is forming. Left surface is formed by left ventricle, and if I talk about diaphragmatic surface, it will be formed mainly by left ventricle and right ventricle. Diaphragmatic surface means on which it is resting on the diaphragm. It merges with a fibrous pericardium. So three surfaces are there. So write down. Heart is having three surfaces. The first is anterior surface, which is also called as sternocostal surface. What is it called as? It is called as sternocostal surface. Heart is having also the sternocostal surface, and it is formed by, anterior surface of sternocostal surface is formed by right atrium and right ventricle, also slight part of the left ventricle. So mainly now the second surface is diaphragmatic surface. So sorry. So sorry. Diaphragmatic surface. If I talk about, okay Sundaram, diaphragmatic surface is mainly formed by right ventricle and left ventricle. Left surface is mainly formed by left ventricle and left auricle. Okay, done. It is mainly formed by diaphragmatic surface, so we have done with this. Now after that we will have the borders. So we will also have the discussion of borders. Yes, you are right. So I just want you to understand borders, and then I will show you the important borders in the radiological image, and then we will solve the MCQs. So see here, borders, if we are talking about the borders, so in this surface only you can see this will be the, so we should use different colors. So okay, so see here. So this is basically the right border, which is formed by the right atrium from the opening of superior vena cava, inferior vena cava. Left ventricle is forming the left border, and below the we have got from the opening of inferior vena cava to the apex of the heart, it is the inferior border, and superior border is obscured by, superior border is mainly formed by the great vessel. So here we will have, this is the S for superior border, this is right border, this is the left border, and this is I for inferior border. Okay. So write on borders of the heart. Write on the heading borders of the heart. So if I talk about borders of heart, we have got superior border, we have got inferior border, we have got right border and left border. So these are the borders of the heart. Now superior border is having the area of great vessels. So actually superior border is the area from where great vessels emerge out. Great vessels emerges out. Right border is formed, if I talk about right border is formed by right atrium from the opening of superior vena cava to inferior vena cava. From the opening of superior vena cava to that of inferior vena cava. This is about the right border. Left border is formed by left ventricle. Inferior border is formed from the opening of inferior vena cava to apex of heart. Okay. So done with this. Now I just want this, this is the PA view of chest, and I just want you to give an idea of all the important structures seen in the PA view of the chest. So what you can see here, this will be the right border, this is the aortic arch, aortic knuckle, this is the left ventricle which is the apex, and this is the inferior border. So basically you will get an idea, this will be the inferior border, this will be the area of great vessels where we will have the great vessels here. This will be the apex of the heart formed by the left ventricle, and this will be exactly the right border, and this will be exactly the left border. So basically in this diagram you can also see the costophrenic angle, costodiaphragmatic angles, and you can see the darkened blackest area is for the air, and trachea is also shown which is having air inside, spinous process has been shown. So here you can see also the costophrenic angles which been visualized in the PA view of the chest. Much more detail you will see in the radiology session, but this is an overall idea of the borders of the heart. Now before ending this topic, let's solve few MCQs related to the topic. Structure covering the heart is all except. Structure which covers the heart is all except. fibrous pericardium, parietal layer of serous pericardium, pericardial cavity, all of the above. Structures covering the heart is all except. Structures which is forming covering for the heart. All of you, please mark your right answer. I will wait for few seconds. Waiting for you to answer. Okay, what is the right answer? C. Pericardium. Structures covering the heart is fibrous pericardium connects. Yes, parietal layer connects. So, structure which is lying outside the heart. All these layers are lying outside or all of the above. So, can you tell me the right answer? Structures covering is all or something else. Osama is telling C. What about others? If I have to choose the answer, I will definitely go with the option. All of the above is the right answer. Absolutely correct. Absolutely correct. Next MCQ. Boundaries of oblique sinus are all except. Now, boundaries of oblique sinus are all except oblique sinus, which is in the left atrium. Can you tell me it is having all these following except? Waiting for your answer few seconds, 30 seconds. For every question you will get just 30 seconds to answer. Boundaries of oblique sinus are all, otherwise I will come up with the answer. I will give you the hint, it was in the left atrium and it was having veins opening. So, which will be the right answer? Already the hint is given. Boundaries of oblique sinus are all except. This is wrong. The correct answer will be, we know that 4 pulmonary veins open in the left atrium of the heart. So, yes, Gajendra, now you have got it the right answer. Yes. Yes, dear. So, now you got the right answer. We know that 4 pulmonary veins open into the left atrial chamber of the heart. So, if I have to choose one, I will definitely go by posteriorly by the right atrium is not. Left atrium is the right answer, in which the vena cava has been shown to be bounding it. Also, we have seen 4 pulmonary veins opening into it. So, if I have to choose one odd man out which is not involved in forming the boundary, I will go with posteriorly right atrium. Boundaries of the base of the heart is all. So, base of the heart, actually base of the heart, I will give you the hint. Base of the heart is left atrium, and which structure opens into the left atrium? Base of the heart is posterior. See this image, I will give you the hint. See this image. Base of the heart is posterior. Can you see? This is the base of the heart which is posterior. So, we can see the pulmonary veins are opening, and if you will see the anterior view, you can see the arch of aorta and all. So, this is in the anterior view. Arch of aorta, pulmonary trunk is all anteriorly, but veins are posteriorly, and base is formed by left atrium, in which the 4 pulmonary veins are opening. Now, give me the right answer. Boundaries of base of heart is all except. Posteriorly, there will be other structures also. Yes, Gajendra, pulmonary veins are opening, but which of the following structure will be not lying in the posterior aspect of the heart, but it lie anteriorly in the heart? Yes, please mark the right answer. The correct answer will be ascending aorta is the right answer. Absolutely, a thumbs up goes for Gajendra. Base of the heart is lying in the posterior aspect of the heart, and base of the heart is primarily formed by left atrium and small part of right atrium. 4 pulmonary veins are opening into it, and it is separated by the vertebral column. If I talk about the base of the heart, it is separated from the vertebral column by the pulmonary veins, esophagus and all. So, basically base of the heart is not having ascending aorta in it. Apex of the heart is felt. So, here this just making a correction, this will be, this word is midline. Now, the hint is already given to you. It is 9 centimeter lateral to, it is 9 centimeter lateral to midline, and it lies in which intercostal space? It lies in which intercostal space? Al-Amin, Gajendra, all of you has given a perfectly right answer. Absolutely correct. The right answer will be 9 centimeters lateral to midline and just medial to mid-clavicular line in the left 5th intercostal space. So, it is located in left 5th intercostal space. Absolutely correct. Yes, a thumbs up goes for you. Then the next one is entry channel of the heart is all except. All of the following is an entry channel of the heart except. Yes, Gajendra, left 5th intercostal space. Yes. Entry channel means actually entry means blood is going in, and one of the structure is from which blood is going out. So, which of the following structure is the structure of the heart from which blood is going out? Which is the exit channel of the heart? Which is the exit channel? I will explain this also. Once I will complete this, I will give you a break of 7 minutes, 7 minutes break, and then again I will come up with the next topic of the heart, where I will tell you also more detail of the heart. So here Karthik has given the answer, Gajendra has given the answer, and a thumbs up goes for both of them. Yes, you are right. Pulmonary trunk is the right answer. Pulmonary trunk is not the entry, but it is the exiting channel. It is the exiting channel. Here, the pulmonary trunk will divide into pulmonary arteries and it will carry the deoxygenated blood from the heart to the lungs where oxygenation is done. And after oxygenation, the oxygenated blood is carried by the pulmonary veins and it is received by the left atrial chamber of the heart. So, absolutely correct. Now we have already covered the heart external aspect. So we have already covered that. External aspect is already has been done. Now what I want that we will go with the internal aspects. Okay. So internal aspect has to be discussed along with the coronary arteries, along with the nerve supply and the venous drainage of the heart. So that is absolutely important. So first thing, all of you just have a look on this image. If you will see this image, you can understand the whole chambers of the heart and how the blood circulation happens in the heart. So I just want to elaborate this. Image. Yeah. So when I am enlarging it, as you can see, I have enlarged this whole of image so that you can have a better idea of the structures being visualized. Okay. So now when you will see this, you can understand very nicely the topics. So I would like to tell that how many chambers the heart is having. The heart is having, everyone, this is just a basic and many of the students must be already knowing this. So these are only basic things and many of the students must be knowing it. So all of you concentrate so that you can understand the facts. So actually there is superior vena cava and there is inferior vena cava. So via superior and inferior vena cava, the blood reaches to the right atrial chamber of the heart. So the blood is reaching in the right atrial chamber of the heart, and from the right atrial chamber of the heart, the blood will go to the right ventricle via right atrioventricular orifice. So it travels into the right ventricle via right atrioventricular orifice. Right atrioventricular orifice is guarded by tricuspid valve. What is the valve which is guarding it? It is guarded by tricuspid valve. Now what happens from the right ventricular chamber of the heart? The pulmonary trunk is emerging out. Okay, the pulmonary trunk is emerging out, and we know that pulmonary trunk is dividing into pulmonary arteries. As you can see here, it is the left pulmonary artery and there will be a right pulmonary artery. So it divides into pulmonary artery and it takes deoxygenated blood which is having less amount of oxygen. It goes to the lungs where the oxygenation of the blood is done. So oxygenation of the blood is done, and now via pulmonary veins, this oxygenated blood, now via pulmonary veins, the oxygenated blood reaches to the left atrial chamber of the heart. So you can see there are pulmonary veins. So we will have another image where you can see there is a pulmonary veins. So actually there are pulmonary veins, and via pulmonary veins the blood will be received into the left atrial chamber of the heart. Left atrial chamber of the heart, the blood will be received which is oxygenated, and from the left atrium it will traverse into the left ventricle. So here we will have this as the left ventricle, and we know that from the left ventricle the arch of aorta arises, and arch of aorta will distribute the blood into the systemic circulation via its all branches. Okay. So is the concept clear? The deoxygenated blood from the superior aspect of the body and inferior aspect of the body is received by the right atrial chamber of the heart. From the right atrial chamber of the heart, the blood which is oxygenated is received by the right atrioventricular orifice guided by a tricuspid valve, and it is received by the right, it will go to the right ventricular chamber of the heart. From the right ventricular chamber of the heart, the pulmonary trunk emerge out, and it will carry the blood which is deoxygenated, and via pulmonary arteries the blood is received by the lungs. In the lungs the oxygenation of the blood takes place, and again via pulmonary veins the blood is carried and it is received by left atrial chamber of the heart. In the left atrial chamber of the heart, the oxygenation of the blood is done, oxygenated blood is received, and this oxygenated blood via left atrioventricular orifice, which is guarded by the mitral valve or the bicuspid valve, is received by the left ventricle. Which structure emerged out from the left ventricle? Ascending aorta, which will divide into arch of aorta, and the blood distribute to whole of the systemic circulation. So is it okay? This is how the blood circulation takes place in the heart. This is how the blood is rotated in the heart, and it circulates via 4 chambers of the heart. Everyone is clear? If any doubt, please tell me. I will again show you an open section of the heart. See this image. See this image. This is superior vena cava. Lower down there will be inferior vena cava. This will be the inferior vena cava. The blood is received by right atrium. The blood, can you see the white arrow? Can you see the white arrow? Now the blood from the right atrium, see here. This is right atrium. This is the right atrium. It will be received by the right ventricle. And this blood flow occurs via right atrioventricular orifice, which is guarded by tricuspid valve. So it is guarded by tricuspid valve. From the right ventricle, the blood will enter into the pulmonary trunk and via pulmonary arteries. So these are right and the left pulmonary arteries. And via right and the left pulmonary arteries, the blood will be going towards the left. It will be received into the lung, and there the oxygenation of the blood is done, and via pulmonary veins. So you can see pulmonary veins. Now this pulmonary veins will have, these are all pulmonary veins. This, and via pulmonary veins the oxygenated blood is received into the left atrial chamber of the heart, and from the left atrial chamber of the heart the blood will received by the left ventricular chamber of the heart, and the guarding of left ventricular chamber of the heart is done by the mitral valve, and here the guarding of right atrioventricular orifice is done by the tricuspid valve. Now this from the left ventricle only you can see the structure which is emerging out is ascending aorta. What is it? This is A for ascending aorta, and this is arch of aorta. So via arch of aorta the blood distribution is done, which is oxygenated. So everyone, please let me know, have you understood this concept? Can we proceed with the interior of the heart? I think many of you must be knowing this also. Everyone done? Can we proceed to the next? Okay. Now let's talk about the chambers of the heart. So first chamber which I am talking is the right atrial chamber of the heart. So actually if I have to summarize, the most important chamber of the heart which needs much of description is the right atrium. So interior of right atrium and right ventricle is very, very important for you to understand. Okay, right atrium and right ventricle. So we will talk about right atrium and right ventricle in details. So when I am talking about right atrium, the external aspect I just want you to show. So if you will see, this is the right atrium. So this is the right atrium, and in the right atrium what you can see, actually right atrium is basically receiving blood from superior vena cava, inferior vena cava, and it's exactly in the interior of the right atrium we have got rough part and smooth part. So the rough part and smooth part is divided by crista terminalis. On external aspect, the crista terminalis is corresponding to sulcus terminalis. So I just want you to see the open aspect. So you can see this is exactly superior vena cava, this is inferior vena cava, which is exactly opening into the right atrial chamber of the heart. And here I just want everybody to understand this. This is sulcus terminalis. What is this sulcus terminalis? Actually sulcus terminalis is corresponding to a line which is running, depressed area which is running from superior vena cava to that of inferior vena cava, and it is corresponding interiorly to crista terminalis, which divides the rough and the smooth part of right atrial chamber of the heart. Now the importance of this sulcus terminalis is that sulcus terminalis close to the outer, in the outer aspect, sulcus terminalis close to superior vena cava has got the location of SA node. What is SA node? It is sinoatrial node, which is the pacemaker of the heart. So there is the location of SA node. Now, if you will see the interior, now I just want you to show, this is showing you the interior of right atrial chamber of the heart. This is showing you interior of. Now, if we open up, what you can see in the interior right chamber, first thing is that this line is the crista terminalis. What is it? This is crista terminalis. This line is crista terminalis, which you can see this is the rough part and this is smooth part. So rough part is formed by pectinate muscle, and smooth part is having new important structure. Also interarterial septum, that is separating the atrium of both the side, will have certain structures opening it. It will have the opening, as you can see, it will have the fossa ovalis, it will have the limbus fossa ovalis. Also the opening of coronary sinus will be seen inside. So also there is one more, so you can see this is the fossa ovalis. Superior to it will be the limbus fossa ovalis. This line is the crista terminalis. This line is crista terminalis, and also the opening of coronary sinus. So opening of coronary sinus has been shown. So the vena cava opening and opening of coronary sinus. Actually, what is the coronary sinus? All the veins of the heart is opening into the interior of right atrial chamber of the heart. Okay. So firstly write down this, then I will tell you about triangle of Koch. So write down about right atrium. Right atrium, superior vena cava and inferior vena cava carries deoxygenated blood from body to right atrial chamber of the heart. Right atrial chamber of the heart. Okay. Now write down what is sulcus terminalis. So write down what is sulcus terminalis. What is sulcus terminalis? What is sulcus terminalis? So if I talk about sulcus terminalis, it is a groove, linear groove. You can say it's a linear groove. It is a linear groove running from the opening of superior vena cava to inferior vena cava on the external aspect of right atrium. Okay? Is it okay? So my dear students, if you are not understanding anything, please let me know. If there is any confusion and you are not understanding anything, please let me know. Now, just write down close to superior vena cava, the sulcus terminalis contains, SA node. SA node is pacemaker of the heart. It is the pacemaker of heart. Is the part of conducting system of the heart. What is it? SA node is a part of conducting system of the heart. It's the part of conducting system of the heart. Done with this. Now what we have to understand further is to know the certain structure which is seen in the interior of the heart. So if I talk about the interior of the heart, so we know that most of the part of the right heart, if we talk about, is basically rough, which is formed by the pectinate muscle, which is forming the interior, and the rough and smooth part of the heart is separated by crista terminalis. So write down. Okay, write down right atrial chamber of the heart. Write down interior of right atrium. Interior of right atrium. The rough and smooth part of the heart, the rough and smooth part of heart is divided internally by crista terminalis. Internally by crista terminalis. It is divided internally by crista terminalis. The rough part of the heart is made of musculae pectinate, which is giving rough appearance to the interior of the heart. Now, in the interior itself, we have got certain structures. So, in the interior itself, we have got certain structure, that is, we will see certain structure like fossa ovalis. So, basically, these are the structures in the septal wall of right atrium. So, these are the structures in the septal wall of right atrium. So, we will have fossa ovalis. Fossa ovalis is actually formed or remnant of septum primum. It is formed or remnant of, you can say, fossa ovalis, which is seen in the septal wall of right atrium, is remnant of septum primum, which is actually denoting foramen ovale of the fetus. The corresponding structure to this fossa ovalis of the adult heart is foramen ovale in the fetus. Now, talking about limbus fossa ovalis. Limbus fossa ovalis. Limbus fossa ovalis. Limbus fossa ovalis. So, if I talk of limbus fossa ovalis, that is also called as annulus ovalis. It is a remnant of septum secundum. Other than that, we will also see the openings of interior, we will see the opening of coronary sinus. Coronary sinus. I just want you to know what is coronary sinus. Actually, coronary sinus is the vein of the heart, and basically all the veins of the heart is draining into coronary sinus. Few veins are directly draining into the chamber, like anterior cardiac vein will be opening inside, but opening of coronary sinus are there. So, basically, if you want to know what all structure open into the right atrial chamber, I will write a list. Okay. So, write down the heading. Structures opening in right atrium. So, there will be opening of superior vena cava in the inside. Opening of inferior vena cava. So, actually this inferior vena cava, coronary sinus, these are all openings are guarded by rudimentary valves. They are all rudimentary valves. Okay, now opening of inferior vena cava, then we will have opening of other structures. Opening will be actually opening of coronary sinus, opening of coronary sinus is there. Right atrioventricular orifice guarded by, there will be also right atrioventricular orifice guarded by tricuspid valve, and there will be anterior cardiac vein which opens, and there will be small vena cordis minimi, small venae cordis minimi. So all these structures which I have written, is opening into the right atrial chamber of the heart. Now we have done with this. Now one of an important structure which I want everybody to understand is the triangle of Koch. What is it? Triangle of Koch. Triangle of Koch. So if I talk about triangle of Koch, it is seen in the interior of right atrial chamber of the heart. The boundaries of triangle of Koch is superiorly by the tendon of Todado, which is just a subendocardial thickening. Inferiorly, if I talk about posterior-inferiorly coronary sinus, and anteriorly by the tricuspid valve septal leaflet. What is the importance? This is containing AV node. The location of AV node is lying in the triangle of Koch. So write on the heading, boundaries of triangle of Koch. Boundaries of triangle of Koch. Boundaries of triangle of Koch. Boundaries of triangle of Koch are anteriorly, it is bounded by tricuspid valve septal leaflet, tricuspid valve septal leaflet. Superiorly by tendon of Todado, that is subendocardial guarding, that is formed by subendocardial thickening, that is subendocardial thickening. And posterior-inferiorly by the opening of, and posterior-inferiorly it is guarded by the opening of coronary sinus, opening of coronary sinus, opening of coronary sinus. And an important point about triangle of Koch is that you have to know what lies inside. So triangle of Koch is containing AV node. Triangle of Koch contains AV node. So write down, triangle of Koch contains AV node. Triangle of Koch contains AV node. Done. Now we have to know about the next chamber of the heart, that is right ventricle. What is it? That is right ventricle. So now we will talk about right ventricular chamber of the heart. So just enlarge it. This is the right ventricular chamber of the heart. So exactly we have done with the right atrium, and this is the right ventricle. So if I talk about right ventricle, inside you can see, so exactly right ventricle external aspect, what you can see, the pulmonary trunk is emerging out, which carries blood, deoxygenated blood in the form of pulmonary arteries to the lung for oxygenation. And the right atrium and right atrioventricular orifice is there for the communication of right atrium and right ventricle, guarded by tricuspid valve. Other than that, it will have in the interior three papillary muscles. As you can see, there is three papillary muscles. And what is papillary muscles? So these papillary muscles are actually connecting the ventricular wall with the coda tendineae of tricuspid valve leaflet. So one more diagram is there which will help you to understand. This is showing you right ventricle. Here you will see the papillary muscles. So you will see the papillary muscles here. Papillary muscles are there. So actually there is anterior posterior septal, or you can say inferior anterior and septal papillary muscles. So these are all papillary muscles. This is a papillary muscle. So this is also a papillary muscle, and this is also a papillary. So here you can see there is a band. What is this band called as? This band is called as septomarginal band or moderator band. So septomarginal band or moderator band is present in the right ventricle, and it is connecting the right ventricular wall with the coda tendineae of tricuspid valve. So what is this is only present in the right ventricle, it is not present in the left ventricle. And why it is important? It is actually preventing over distension of the right ventricular chamber, and it is the conducting part of the heart. So please write down, this is all about the interior. So write down right ventricle. Right ventricle. So right ventricle is pulmonary trunk emerges out from right ventricle and via pulmonary arteries carries deoxygenated blood to lungs, where oxygenation of blood is done. And where oxygenation of blood is done in the interior of right ventricle. Now talking about interior, so write down interior of right ventricle. So if I am talking about interior of right ventricle is having three papillary muscles, that is anterior, posterior and septal. That is anterior papillary muscle, we have got posterior papillary muscle, and we have got septal papillary muscle. And also there is a presence of, so this is about papillary muscles, and in the interior there is also the presence of septomarginal band. Septomarginal band. So the other name of septomarginal band is, it is also called as moderator band. It is also called as moderator band. It's also called as moderator band. So if I talk about moderator band, this is a muscular ridge extending from ventricular septum to the base of anterior papillary muscle, to the base of anterior papillary muscle across ventricular cavity, across the ventricular cavity. Okay, and it is the component of conducting system of the heart, and it prevents over distension of right ventricular chamber of the heart. So it is, what is the function of septomarginal band or moderator band? It is preventing over distension of right ventricular chamber of the heart. It prevents over distension of right ventricular chamber of the heart. Now coming to left atrium. So if I talk about left atrium, basically we have got the openings of, so basically what happens now, the blood from the pulmonary veins, via pulmonary veins, it is received by the left atrial chamber, which is oxygenated, and from left atrium it moves to the left ventricle via bicuspid valve guided by mitral valve. So most of the part of the left atrium is smooth. So this is showing you the pulmonary veins opening into the left atrial chamber of the heart. This is mainly the smooth part. So basically most of the part of left atrium is smooth. Write down. Blood from, now write down, oxygenated blood from the lung, oxygenated blood from the lungs, oxygenated blood from the lungs via pulmonary veins is received by left atrium. From left atrium, the blood flows via left atrioventricular orifice, left atrioventricular orifice, left atrioventricular orifice guarded by bicuspid valve, guarded by mitral or bicuspid valve. So what is the guarding? Which structure guard this? So this is guarded by bicuspid valve or mitral valve. Now the next chamber is the left ventricle. Now the blood has been received in the left ventricular chamber of the heart. Now in the left ventricular chamber of the heart, you can again see there is two papillary muscle, anterior and posterior papillary muscles. And what I told you, these papillary muscles are connected with the coda tendineae of the bicuspid mitral valve, as you can see, and there is no moderator band, but the wall. But actually oxygenated blood is received. If I talk about this, oxygenated blood is received. If I talk about oxygenated blood, it is received. So oxygenated blood is received by, if I talk about this, oxygenated blood is received by the left ventricle, and via ascending aorta it is distributed to. So and via so exactly what will happen via pulmonary, actually what happens, via ascending aorta and arch of aorta is distributed to the systemic circulation. So the wall or ventricular wall of left ventricle is 3 times thicker than the right ventricular wall, and contains two papillary muscles only, and there is absence of moderator band. So write down left ventricle. Write on the heading left ventricle. Left ventricle receive oxygenated blood from left atrium. Its walls are 3 times, its walls are 3 times thicker than right ventricular wall. It contains only two papillary muscle, that is anterior and posterior, and no moderator band, okay. It contains two papillary muscle, anterior and posterior, and contains no moderator band. Done. Now we will talk about the coronary arteries. The next topic is coronary arteries. Okay, so coronary arteries, it's a very important topic and so many questions has been asked from this. So we have to know, actually there are two coronary arteries. We have got right and the left coronary arteries. Basically these coronary arteries are functional end arteries. Why functional end arteries? Because they are anastomosing with the neighboring arteries. But they are, so basically they are anastomosing with the neighboring arteries, and they are that anastomosis is not enough to maintain the nutritional demand of the myocardium or walls of the heart, so they are called as functional end arteries. So we have to know about these two coronary arteries, that this is a branch, this is arising from which structure. So actually they are arising from aortic sinuses of ascending aorta. Right coronary artery arises from anterior aortic sinus, and we have to know the important branches of right coronary arteries. It gives various important branches. It gives arterial branches, conus branches, right ventricular branches. It gives posterior interventricular branches. It gives marginal branches. It gives blood supply to SA node and AV node. So basically, here in this cadaveric image, you can see the coronary. So this is the conus branch, this is the right coronary artery as shown, and you can see it is giving various branches. This is the right coronary artery winding posteriorly, and it gives various branches. It is giving marginal branches, it is giving conus branches. So and this side you can see this is the left coronary artery. This is anterior interventricular branch, which is basically the branch of left. This is also giving diagonal branch, which is basically giving only blood supply to the left ventricle. So actually in this diagram also you can see the right coronary artery, and it is giving marginal branch, it is giving and here the left coronary artery, which will be giving anterior interventricular branch. And actually two important branches are there. In the right coronary artery gives posterior interventricular artery, which is called as posterior descending artery, which is the artery of dominance. Why it is called as artery of dominance? Because this is the deciding factor that which part of the heart is dominant, that is the right part of the heart. Right coronary artery in 90% of the cases gives posterior interventricular artery, which is also called posterior descending artery, and posterior interventricular artery is giving blood supply to the maximum part of the heart, so it is right dominant heart. In 10% of the cases, it can be a branch from left coronary artery. Left coronary artery gives two important branch, anterior interventricular artery, which is also called as LAD artery, left anterior descending artery, which is commonly involved in the formation of clot and is most commonly involved in case of myocardial infarction. The other important branch which it gives is the left circumflex artery. So here you can see again the tricuspid valve has been opened up, showing communication between right atrium and right ventricle, the left ventricle, and the here we can see also the bicuspid valve. We can see the pulmonary trunks. We can see the septums, interventricular septums also clearly here in the open. This is an open part or open section. So please see this cadaver. This is the open part of the cadaveric heart. Now we'll come to veins. So firstly, please write down the important arteries. So write down about arteries. So coronary arteries. So two arteries. Coronary arteries are Coronary arteries are functional end arteries. Coronary arteries are functional end arteries, and the concept why they are functional end arteries has already been told to you. So already I have told you the concept why coronary arteries are called as functional arteries, functional end arteries, because it is because right and the left coronary arteries anastomosing among themselves, but this anastomosis is not enough to maintain the nutritional demand of the myocardium of the heart. So they are not enough. So only if coronary arteries are blocked, what will happen? Myocardial infarction, heart attack will happen. So that is important. So we have to go, ultimately blockage is there in important arteries, so we can have to go for that of the coronary bypass surgeries. So firstly I would like to tell about right coronary artery. Right coronary artery arises from anterior aortic sinus. Now write down branches of right coronary artery. Branches of right coronary arteries. Right coronary artery arises from anterior aortic sinus, and you have to know the branches. So it is giving various branches. It gives right conus artery. It gives arterial branches, which is giving blood supply to SA node. So it is giving SA node blood supply. It is also giving anterior ventricular branch. Which also gives marginal artery. It also gives posterior ventricular branch. It also gives posterior interventricular artery. Posterior interventricular artery. It also gives posterior interventricular artery. Actually, posterior interventricular artery is called as the dominant artery of the heart. So this is called as the artery of dominance. Here it is very important for you to know. This has been asked in the MCQ. So many times the question has arrived that which is the artery which is called as artery of dominance. So basically, if we talk about this coronary artery, so basically if I talk about the coronary arteries, posterior interventricular artery is deciding factor for the artery dominance. Posterior interventricular artery is the artery of dominance. It is called as the artery of dominance. In 90% of cases, it is branch of right coronary artery. What does that mean? That means in 90% of individual we have got right dominant heart, and basically I just want everybody to note down that why the posterior interventricular artery or the posterior descending artery is regarded as the artery of dominance, because this is the artery which is supplying major part of the heart. So it is giving blood supply to following reasons. So please write down ABC. So posterior interventricular artery is giving blood supply to posterior interventricular septum. It is giving blood supply to posterior interventricular septum. Posterior interventricular septum, it gives blood supply to AV node. It gives blood supply to both right and left ventricle. Blood supply to both right and left ventricle. Got it? Now, the next important thing is we will talk about the So exactly, next I would like to talk about the left coronary artery. So write on the heading left coronary artery. Left coronary artery. Left coronary artery. So if I talk about left coronary artery arises from or originates from left posterior aortic sinus. Left posterior aortic sinus. Left posterior aortic sinus. It arises from left posterior aortic sinus. Left coronary artery arises from left posterior aortic sinus. Left coronary artery arises from left posterior aortic sinus. Branches, write down branches of left coronary artery. Branches of left coronary arteries. So the branches of left coronary arteries are, important branches are LAD artery. What is LAD? The full form of LAD is left anterior descending artery. Left anterior descending artery. Actually, left anterior descending artery is also called as left anterior interventricular artery. It is also called anterior interventricular artery. Posterior interventricular artery is a branch of right coronary artery. Anterior interventricular artery is a branch of left coronary. So it is also called as anterior interventricular artery. It is called anterior interventricular artery. The other branches which it gives is circumflex artery. It gives circumflex artery. It gives diagonal artery. It gives branches like diagonal artery. It gives a branch like conus artery. It gives the branches like arterial branch. It gives arterial branch. So all these are the branches of basically, and I just want you to tell that this diagonal artery is giving blood supply only to left ventricle. It is giving blood supply only to left ventricle. Anterior interventricular artery can overlap both right and the left ventricle, but diagonal artery, circumflex artery, these are the important parts. So exactly, I also want everybody to note down, because here left anterior descending artery is a major artery. So you have to know major part of the heart which it supplies. So you can just write here. Here in the box as a note point, you can write left anterior interventricular artery, left anterior interventricular artery, left anterior interventricular artery is giving blood supply to anterior part of interventricular septum. It gives blood supply to anterior part of interventricular septum. It gives blood supply to greater part of left ventricle. Greater part of left ventricle. This is greater part of left ventricle. Greater part of left ventricle, and it also gives blood supply to the part of bundle office. Part of bundle office. Okay. So done with this. Now before proceeding to venous drainage, I just want everybody to have a note of one important point, the arteries which is involved in thrombus formation. So major artery which is involved in the clot formation. So write on. Common arteries involved in myocardial infarction, or you can say common arteries involved in thrombus formation. So major arteries which is involved in thrombus formation has to be known to you, and you should be knowing in the order. So most commonly which artery is involved, and that is very important. So if I talk about the major artery being involved, the major artery involved in thrombus formation is LAD artery, left anterior descending left circumflex artery, and right coronary artery. So the major artery, most commonly involved artery is LAD, that is left anterior descending artery. This is most commonly involved. This is most common. The other arteries which will be involved in the thrombus formation is circumflex artery, and that of right coronary artery. Done? Done. Now we will talk about the venous drainage. The next topic which I want everybody to understand is the venous drainage. So venous drainage, if I talk about the major important veins which is draining. So if I talk about the important veins which is draining the heart, is three categories of the veins are there. Coronary sinus. Why? Coronary sinus is important. Why? Because all the veins of the heart, whether it is great cardiac vein, whether it is middle cardiac vein, whether it is oblique vein of Marshall, whether it is a small cardiac vein, major veins are draining. Left posterior ventricular vein, all the veins are draining into coronary sinus, and coronary sinus is opening into the right atrial chamber of the heart. We have got anterior cardiac vein and small vena codis minimi, which is not draining into coronary sinus. They are draining into right atrial chamber and respective heart chambers. So this is the heading you can write on, venous drainage of the heart. Venous drainage of the heart. So here you can see, if you will see this venous drainage of the heart, what you can see, there is coronary sinus which is opening into the right atrial chamber of the heart. As you can see, it is opening into the right atrial chamber of the heart, and in this coronary sinus, oblique vein of Marshall, left posterior vein of left ventricle, great cardiac, middle cardiac, right marginal, small cardiac, all are draining. This anterior cardiac vein is separately opening into the right atrial chamber of the heart. It is not draining via coronary sinus, but it is separately draining into the right atrial chamber of the heart. So write down venous drainage of the heart. Venous drainage of the heart. Venous drainage of the heart. All the veins of heart mainly drains into coronary sinus. So the major veins draining, one will be coronary sinus, the other will be anterior cardiac vein, so coronary sinus also opens into the right atrial chamber of the right atrial chamber. This anterior cardiac vein also opens into the right atrial chamber of the heart. And vena cordis minimi. Vena cordis minimi. When I am using the word vena cordis minimi, it means small veins are also draining in the heart. So, small veins are also draining in the heart. Vena cordis minimi. Small veins are also draining into the heart. That is vena cordis minimi. Now, done with it. Now, we will talk about. So, exactly, I just want everybody to understand that important veins of important veins of the heart. See, right on. So, three important veins are there. One is great cardiac vein. Why I am writing this? It runs along with, so great cardiac vein runs along with anterior interventricular artery. Anterior interventricular artery. The middle cardiac vein. So, we have got middle cardiac vein also. We have got middle cardiac vein. This runs along with posterior interventricular artery. Posterior interventricular artery. And we have got small cardiac vein. And the small cardiac vein is running along with coronary artery, along with the right coronary artery. And all the veins ultimately draining into which chamber of the heart? Right atrial chamber of the heart. All these are draining into right atrial chamber of the heart. So, done with this. Now, the next thing which I want to start, this will be important for the nerve supply of the heart, is the cardiac plexus, is to know the cardiac plexus. So, let's start. So, write down nerve supply of the heart. So, when I am talking about nerve supply of the heart, so nerve supply of the heart is important, nerve supply. So, actually when I am talking about nerve supply, it is getting autonomic innervation both via sympathetic and parasympathetic innervation. So, when I am talking about sympathetic innervation, it is via the sympathetic trunks branches, and vagus is the parasympathetic innervation. So, parasympathetic innervation is cardio inhibitory. It decreases the blood pressure and the heart rate. Sympathetic is cardio acceleratory. It is increasing the heart rate and the blood pressure. Actually, the innervation of the heart via sympathetic and parasympathetic innervation occurs via formation of cardiac plexus. So, I would like everybody to know where is the superficial cardiac plexus located and where is the deep cardiac plexus located. So, in this diagram we can see here, this is the superficial cardiac plexus. This is the superficial cardiac plexus. Superficial cardiac plexus is formed by, it is located, its location is below the arch of aorta. As you can see, this is located below the arch of aorta and in front of pulmonary trunk bifurcation. This is the location of superficial cardiac plexus. This is the location of superficial cardiac plexus. Now, if we talk about formation, superficial cardiac plexus is formed by superior cervical cardiac branch of left cervical sympathetic trunk and inferior cervical cardiac branch of left vagus nerve. Okay, so write down. Heart is supplied by both sympathetic. Yes, thank you, dear. Yes, dear. Heart is supplied by both sympathetic and parasympathetic innervation. Okay, so the heart is getting innervation from both sympathetic and parasympathetic innervation. Okay, now sympathetic innervation is cardio acceleratory. Cardioacceleratory means it increases the blood pressure and it increases the heart rate. Parasympathetic innervation is cardio inhibitory. That means it decreases the blood pressure and it decreases the heart rate. It decreases the blood pressure and decreases the heart rate. Now, innervation of the heart will be happening via cardiac plexus. Will be possible via cardiac plexus formation. So, innervation. So, firstly, I would like everybody to understand what is superficial cardiac plexus. Superficial cardiac plexus. And where it is located. So, superficial cardiac plexus. When I am talking about superficial cardiac plexus, it is located below arch of aorta. It is located below arch of aorta and in front of it is located below arch of aorta and in front of bifurcation, in front of pulmonary trunk bifurcation. Now, formation is also important. Formation of superficial cardiac plexus. The formation of superficial cardiac plexus is via superior cervical cardiac branch, via superior cervical cardiac branch of left cervical sympathetic trunk, left cervical sympathetic trunk, an inferior cervical cardiac branch of an inferior cervical cardiac branch of inferior cervical cardiac branch of left vagus nerve, left vagus nerve. So done. So we have done with this. Now I just want you to show another image which is of deep cardiac plexus, which is of deep cardiac plexus. So yes, we will finish with this, and I just want, after finishing this, before starting lung and pleura, we will solve few MCQs related to this hot topic, and then we will move on with the lung and bronchopulmonary segment. So so be connected, dear, be connected. Okay, so this is deep cardiac plexus, which is located anterior to the tracheal bifurcation. This is the deep cardiac plexus, which is located anterior to tracheal bifurcation. The formation, so you can see deep cardiac plexus is formed by all the branches from the vagus nerve except the inferior cervical branch of left vagus and all the branches from the sympathetic chain branches. So exactly it is formed by all cardiac branches of cervical, the 3 cervical and 4 and 5 thoracic ganglia, except that that is superior cervical cardiac branch of the left cervical sympathetic trunk, which is taking part in formation of superficial cardiac plexus. So all other forms deep cardiac plexus. So write down deep cardiac plexus. Write down the heading deep cardiac plexus. So I will talk about the formation and location of deep cardiac plexus, and then we will solve few MCQs of the heart and related topic, and then we will move in the next topic, that is lungs and bronchopulmonary segment. So deep cardiac plexus is located, deep cardiac plexus is located Deep cardiac plexus is located in front of tracheal bifurcation. In front of tracheal bifurcation. Formation. Now the next thing is formation of deep cardiac plexus. Formation of deep cardiac plexus. Now formation of deep cardiac plexus, if I talk about formation of deep cardiac plexus, is it is formed by all the cardiac branch of, it is formed by all the cardiac branch of 3 cervical and 4 or 5 thoracic ganglion, 4 or 5 thoracic ganglion of sympathetic chain, except of sympathetic chain, except superior cervical cardiac branch of left cervical sympathetic chain, left cervical sympathetic trunk. Why not the superior cervical cardiac branch of left cervical sympathetic trunk? Because this take part in formation of superficial cardiac plexus. So this is the first point of formation. The second point is all cardiac branches of vagus, all cardiac branches of vagus nerve, vagus recurrent laryngeal nerve, all cardiac branches of vagus nerve except inferior cervical, cardiac branch of, inferior cervical cardiac branch of left vagus nerve. Done. So we have got all these points. So we have got this about the formation of cardiac plexus. Okay. And we have to know this in detail. Okay. So we have done. With this, we have finished with the topic of heart and pericardium. Actually, that whole topic was a big topic. And I think your concepts are clear. Now, can we solve few MCQs related to the topic? Are you ready for it? So students, can we solve few MCQs related to this topic? Everyone? So let's start with the first MCQ. All of the following forms the boundary of marked, area in the image except. All of the following forms the boundary of marked area in the image. So that means you have to identify this image first. All of you plus see this image firstly. What is this image? Try to identify this triangular image. One of the space is opened up. So one of the chamber of the heart is opened up and you have to identify that chamber and you have to identify this triangular area. All of the following is forming the boundary of this triangular blue color highlighted area in the image except. Now mark the right answer. Except. Which will be the right answer? Can you tell me this triangular area is which area? What is this triangular area signifying? Which triangular area is this? This triangular area is triangle of Koch. So I have given you the hint that this triangular area is triangle of Koch. Now tell me what is not forming the boundary of triangle of Koch? Which of the following structure is not forming the boundary of triangle of Koch? Coronary sinus, tendon of Todado, septal leaflet of tricuspid valve, superior vena cava. Anyone? Not able to identify? The right answer will be superior vena cava. Superior vena cava is not involved in forming the boundary. Superior vena cava is not involved in forming the boundary of marked area. So definitely, yes, I got an answer from isomedicine, absolutely correct. So isomedicine is given absolutely correct answer. Yes, dear. You have given absolutely correct answer. Now moving to the next question. So basically you can see this area which has been shown, this triangular area which has been shown is triangle of Koch. And what does it contains? It contains AV node. It contains AV node. So one more image is there which is showing you the boundaries of triangle of Koch, which is having the boundary tendon of Todardo, subendocardial thickening above, tricuspid valve leaflet anteriorly, posterior inferiorly coronary sinus, and the structure which is lying inside is the AV node. Now, right coronary artery arises from which aortic sinus? Right coronary artery arises from which aortic sinus? Can you tell me the right answer? Right coronary artery arises from which aortic sinus? Whether it is anterior aortic sinus, right posterior aortic sinus, left posterior aortic sinus, from the anterior and posterior aortic sinus. Which is the right answer? Right coronary artery arises from which of the following aortic sinus? Right coronary artery arises from which aortic sinus? The right answer is, anyone? Isomedicine, Umar, Vicky, Gajendra, Karti, Al Alam, anyone? The right coronary artery arises from which of the following aortic sinus? The right answer is anterior aortic sinus. A is the right answer, the anterior aortic sinus. Left is from left posterior aortic sinus, right is from right anterior aortic sinus. Now, the other question is, blood supply of interventricular septum is via blood supply of interventricular septum. Now, blood to the interventricular septum is supplied by only right, only left, anterior half, posterior half, anterior 2/3 and posterior 1/3 by right coronary artery. Blood of interventricular septum. The next question is blood of interventricular septum. Blood to the interventricular septum is supplied by anyone? No, anterior 2/3 is by left coronary artery and posterior part is by it's by the right coronary arteries via anterior interventricular and posterior interventricular branches, which I have written. So I think you can correlate with the notes. If you have not written, you can get confused. Now this question is, so actually this was the third question. This will be question number 4. Now all of the following, which of the following is not supplying the marked area of the heart? So basically this is an image based question. What I want everybody, so firstly see this image. I am enlarging this image. Firstly see this image. I have enlarged this image. So you have to identify this arrow marked chamber of the heart. So firstly all of you should identify which chamber of the heart is it. Whether it is right ventricle, whether it is left ventricle, whether it is right atrial chamber of the heart. Left atrium to ho hi nahi sakta. Left atrium can't be the chamber of the heart because left atrium is lying posteriorly. So which chamber of the heart is it? Firstly identify that. Which chamber of the heart is this? After that you can come to the answer. Which of the following is not supplying the marked area of the heart? Whether it is right coronary, right interventricular artery, marginal or diagonal artery. So the right answer is, this is which chamber of the heart? So this is right ventricle chamber of the heart. This is right ventricular chamber of the heart, and diagonal artery is the right answer because diagonal artery is giving blood supply to only left ventricle. It is giving blood supply to only left ventricle. Other than that, right coronary is also giving blood supply to right and left ventricle both. Lad artery is also giving blood supply to right and left ventricle both. Marginal will also give blood supply to right and left ventricle both. So the odd man out and the correct answer is diagonal artery, which was a small branch from the, it's a small branch from the left coronary artery, and it gives blood supply only to left ventricular chamber of the heart. So you can see this is the left ventricle and this is the diagonal artery. This diagonal artery is a branch from left coronary artery, and you can see it is giving blood supply only to left ventricular chamber of the heart. It is not giving blood supply to right ventricle. This is right ventricle, and you can see branches from right marginal, posterior descending, anterior descending, all these are giving branch to the right ventricular chamber of the heart. Understood everyone? This is showing you coronary arteries. Now let's talk to the next topic. Let's start with the next topic, the pleura and the lung. The next topic is pleura and the lung. Can we start with the next topic, pleura and the lung? So if I talk about the pleura, pleura is like a peritoneum. It's made of serous membrane and it is lined by flattened epithelium which is called as mesothelium. The lining epithelium, that is the pleura, mesothelium, is secreting a watery lubricant serous fluid which is for the lubrication of the lungs. So basically pleura is having an outer layer which is the parietal pleura. It is having an inner layer which is the visceral pleura, and in between the parietal and visceral pleura there is presence of pleural cavity which is required for the lubrication of the heart. Please write on. So pleura, just write down about the pleura. If anyone is having any doubt, you can let me know. So basically, let's start. Pleura. So pleura is like peritoneum. Pleura is like a peritoneum and it is a serous membrane. It is a serous membrane lined by flattened epithelium. It is lined by flattened epithelium called as mesothelium. The lining epithelium secretes, write down, the lining epithelium secretes watery fluid. It secretes watery fluid, that is watery lubricant, which is forming a watery lubricant called as serous fluid, for lubrication. We'll come to the pleural cavity also. And now if I talk about nerve supply of the pleura, so basically the nerve supply of the pleura, if I am talking of the nerve supply, so basically nerve supply will be different for the, so basically visceral pleura will have the same nerve supply as the lung and the parietal pleura will have the nerve supply as the thoracic wall. So that is important. Parietal pleura nerve supply is parietal pleura nerve supply is same as thoracic wall, and we have already covered the thoracic wall, so I am not writing it once again. And here you can write visceral pleura nerve supply is same as lungs. So blood supply same goes with that. Parietal pleura will have the blood supply similar to the thoracic wall, is similar to thoracic wall, is similar to thoracic wall, is similar to thoracic wall. So via branches, so via which all arteries? So many arteries are there which I have already done. Intercostal arteries, via intercostal arteries, via intercostal arteries, superior phrenic and inferior phrenic arteries, superior phrenic arteries, inferior phrenic arteries, branches of internal thoracic artery, branches of internal thoracic artery, pericardiophrenik artery, like so branches of internal thoracic artery, that means pericardiophrenik artery, and that of musculophrenic artery. So it is via pericardiophrenik artery and musculophrenic artery. Visceral pleura, when I talk about visceral pleura, the visceral pleura will be having the nerve supply same as lungs, same as lungs. Okay. And I also want everybody to note down that when I am talking about exactly if I am talking about the pleural cavity, so you should know where is the pleural cavity lying. That is also important for you to know. Where is the pleural cavity lying? Okay. So done with this, now just write down. In between parietal and visceral pleura, we have got the pleural cavity containing pleural fluid, Done, everyone? Now we will talk about proper lungs. So now we are coming to an important topic, that is lungs. So we have to know about the details of the lungs. So when I am talking about the lungs, we know that the lungs has got certain external features, and what is important for us is to know the relations of different part of the lungs, which is highly important. So we know that lung is having an apical part, the lung is having a basal part, lung is having an outer aspect, that is the costal aspect, and it is having a medial part. Medial part is again divided into vertebral part and mediastinal part. So here you can see the external features of the lung. So here you can see the right and the left lung has been shown, and we can basically see the anterior border, the inferior border, the costal surface, the apex, and the lingula, and the cardiac notch is present in the left lung only. Here also you can see the right and the left lung has been shown. So you can see inferiorly the diaphragmatic surface, the medial surface, if I talk about, it is again divided into two parts, the mediastinal and the vertebral part. What is important for you is to know the relation of individual part of the lungs. So let's start with this. So write down the heading. So here we have written same as the blood supply and all. So parietal pleura nerve supply is like if you want to know, this is like intercostal nerves and phrenic nerves, intercostal nerves and phrenic nerves. If you want to know about thoracic, then it will be similar to visceral, will be, it is having actually it will be having splanchnopleutic nerves, T2 to T5 splanchnopleutic nerves will be there to give the innervation. Now talking about the features and what is for the different parts of the lung. So we have seen the external features in the image, and we have to know about the relations of different parts. So write down lungs, write down the heading lungs. Okay, dear. So lungs is having apex, lungs is having base, lungs is having borders, lungs is having the surfaces. So apex. So I will write down the heading apex. So when I am talking about the apex of the lung, so the apex of the lung, apex of the lung relation. So we are talking about, the heading will be relation. So we are talking about the relations of the lung. So here if I am talking about the relations of apex of the lung, so apex of the lung is anteriorly related to, it is related anteriorly to subclavian artery. It is related anteriorly to subclavian artery. It is related to internal thoracic artery. It is also related to internal thoracic artery. And it is related to scalenus anterior muscle anteriorly. Scalenus anterior muscle. So this is about the relations of the lung on anterior aspect. Now talking about the relations of lung on the posterior aspect, posteriorly. So posteriorly the lung is related to neck of first rib, and structures related to it, and structures related to it. So when I am telling the structures related to the neck of first rib, I mean to the, so basically there are structures related. The mnemonic is van pulling van. So the neck of, so basically posterior it is related to the neck of first rib and structures related. So the mnemonic is van pulling chain. The mnemonic is van pulling chain, and the structures are V for vein. So the first posterior intercostal vein, the first posterior intercostal vein, A for first posterior intercostal artery, first posterior intercostal artery. N for nerve, N for nerve. So the nerve is ventral ramus of first thoracic nerve, ventral ramus of first thoracic nerve. Ventral ramus of first thoracic nerve. And we have got the sympathetic chain pulling vein. So we have got the sympathetic chain. Okay. So all these structures are related on the posterior. So we have done with the relation of apex of the lung, posterior aspect and the anterior aspect. What about the base? Then we will come to the more relations. Okay, then we will have the base. Okay. So what about the base? So please write down the relations of, this is external surface of both the lung, which is apex base, which will be lying over the, resting over the dome of the diaphragm, which will resting of the dome of the diaphragm, the cardiac notch on the left lung. The anterior border has been shown, the costal and mediastinal surfaces. So let's talk about the base. The base of the heart, the base of the lung, sorry, base of lung rests on the dome of diaphragm, rests on the dome of the diaphragm. The costal surface relation, costal surface. So if I talk about the relations of a costal surface is large, smooth, convex, covered by endothoracic fascia, and costal surface is related to, so you can just write down, it is related to upper 6 ribs in mid-clavicular line. In mid-clavicular line, it is related to upper 8 ribs in mid-axillary line and it is related to upper 10 ribs in scapular line. I just want everybody to understand actually this relation of the costal surface of the lung which is convex and on outer aspect is related with the thoracic wall, which is it is related to the ribs basically. So basically ribs relation in the mid clavicular line is 6, then mid axillary 8 and scapular is 10. If we are talking about the pleura relation, it will be 2 ribs more, then it will be upper 8 ribs in mid clavicular line, it will be upper 10 ribs in mid axillary line and upper all the 12 ribs in the scapular line if we are talking about the relation of the pleura. So we have done with this. Next we have to know the relation of the medial surface and how medial surface, I told you it's divided into 2 parts, mediastinal and vertebral part. So write down medial surface. Next heading is medial surface. So when we talk about medial surface, it is divided into 2 parts, vertebral part and mediastinal part. Vertebral part and mediastinal part. So relations of vertebral part and mediastinal part. So vertebral part relation, if I talk about mediastinal surface, vertebral part is related to so the whole of the medial surface is divided into small vertebral and large mediastinal part. So vertebral part is related to basically, if I talk about, it is related with vertebral columns, mainly the thoracic part of the vertebral column. It is related to posterior intercostal vessels. And greater and lesser splanchnic nerves, and also it is related to greater and lesser splanchnic nerves. Greater and lesser splanchnic nerves. Now talking about the mediastinal part, the next part relation is mediastinal part. So for that, firstly I want you to know about mediastinal part relation is different for right side and left side slightly. So basically in this diagram you can see relations of the mediastinal part of the surface. So this is of right side, this is of right lung. So in right lung basically you get a gyrus vein groove, you get a groove for a gyrus vein there and also the groove for superior vena cava. It is related with the right atrium chamber of the heart and that is esophagus, and that of esophagus is there, and we have got trachea, we have got right brachiocephalic vein and all structures related. Okay, now if we will talk about left lung, so left lung we will see the descending arch of aorta and descending thoracic aorta, descending aorta which is branch of subclavian and innominate arteries, and the impression of the heart part will be left ventricle. So this is of the right lung and this is of the left lung. Now here this is showing you the relations of mediastinal surface of, on what side you can set right lung and the other side you can write left lung. So left lung thoracic duct, left lung arch of aorta, descending thoracic aorta, and nerves and left recurrent laryngeal, right side superior vena cava, brachiocephalic vein, arch of azygos vein, We have got trachea, esophagus, we have got the veins as related in the right side. So basically I would like to give you a table for it, or we can write the relations. So please write down, firstly write down here, you can write relations of mediastinal surface of right lung. Write down relations of mediastinal surface of right lung. Relations of mediastinal surface of right lung. Relations of mediastinal surface of right lung. Okay. Now, here we have to know about the important relations of mediastinal surface of right lung. The structures related are, please note down. So, please note down all the important structures related to the mediastinal surface of right lung. Important structures related is right atrium, superior vena cava and inferior vena cava, a gyrus vein, right brachiocephalic vein, the esophagus and the trachea, Then we have got the relations of neuronal structure, three neural structures. So we have got the relation of three neural structures also related, and these three neuronal structures are, please write down the name of these three neuronal structures. So we have got three nerves: the right phrenic nerve, we have got the right vagus nerve, and we have got right sympathetic chain. Okay. Now talking about the relations of mediastinal surface of left lung. Now we will talk about the relations of mediastinal surface of left lung. Write down the heading. We have done with this. Now write down relations of mediastinal surface of left lung. Relations of mediastinal surface of left lung. Relations of mediastinal surface of the left lung. So the important structures related on the left lung, we will talk about that, and the important structures are, please write down. It is related with which chamber of the heart? So if I talk about left lung mediastinal surface relation, so left lung mediastinal surface relation, so it is related with following structures. So okay, all of you will cover up the topic of lung, whole bronchopulmonary segment and everything. Then we will solve an MCQ related to the topic, and then I will give you a 5 minutes break. Okay, then we will have small topics like trachea, esophagus, a gyrus vein, thoracic duct and all. Okay, relations of mediastinal surface of the left lung is, it is related with the left ventricle, it is related with the ascending aorta, it is related with arch of aorta, It is related with descending thoracic aorta. It is related with left subclavian and left common carotid artery. It is related with left subclavian and left common carotid artery. Left common carotid artery. It is related with esophagus. It is also related with thoracic duct. It is related with following neuronal structures. Okay, so it is related with following neuronal structures, and what are they? We have got 4 nerves related in the left hand side, in the left mediastinal surface of the lung, and the 4 neuronal structures are left phrenic nerve, we have got left sympathetic chain, we have got left vagus nerve related, and we have got left recurrent laryngeal nerve, Okay. Done with this. So these are all neuronal structures. This is the relations of mediastinal surface of the lung, left lung. This is the relation of mediastinal surface of right lung. Now this is exactly showing you the fissures of lung, So here you can see there is just one oblique fissure in the left lung, but there is horizontal and oblique fissure, 2 fissures in the right lung. So that means the right lung will have 3 lobes and the left lung will have 2 lobes. What does that signify? That signifies that left lung will have 2 lobes and the right lung will have 3 lobes. So proceeding with it, we should have the discussion of a very important topic, that is bronchopulmonary segment. Before that, arrangements of the structures in the hilum of the lung, that is also important. So see here. So before bronchopulmonary segment, I want everybody to know about the structures related in the hilum and the root of the lung. So before that, okay, firstly let's talk about the hilum structure. So write down. So basically you have to know difference between hilum and root of lung. So why it is important to know both of it, hilum and root of lung? So why I will tell you, you have to know about this, because when I am using the word hilum, what does that mean? When I am using the word hilum, it means the area of the lung where the structures are going in and out. The area of the lung where the structures are going in and out. And root means the structures which is going in and out. So this is the difference. So for example, this is the sleeve of my t-shirts and this is my hand. So this is root and this sleeve is the hilum area. So hilum has an attachment of pulmonary ligament. Now, if we will see the relation of the structures in the hilum or in the root or hilum of the lung from before to backward or from anterior to posterior, it is similar on both the sides. So that is similar on both the sides. So you can just see this image. So you can see here, this is the hilum area and of right and the left side. So there is actually in the hilum, there is pulmonary artery, bronchial arteries, veins. Their relation is similar on both right and the left side, but the relation differs when you proceed from before to backward. So that is important. So firstly, please write down the heading. Relations of write down the heading. Relations of structures in hilum of lungs is similar for both, similar in both lungs. when we proceed, when we see the relation anterior to posterior, when the structures relation are seen anterior to posterior, okay, then the relation is similar. Then the relation is similar. It is different when we go from above to down. So the relations are, the mnemonic is VAB. The relations are of the structures will be VAB. So that means the first structure or anterior most structure will be pulmonary vein. Then we will have pulmonary artery, and then we will have B for bronchus. B for bronchus. So these are the structures related as you proceed from before to backward. This is similar on both the sides. The difference lies when you are proceeding above to down, which is dissimilar on both the sides. So here I just want actually arrangement of structures in the root of lung. So write on heading from above to down in right lung. In right lung. In which lung? In right lung. And the relation of structures are, the most superior most structure is eparterial bronchus. Is eparterial bronchus. Actually, I just want you to understand why this difference happens. This difference happens because there is one principal bronchus in the left side. There is always one principal bronchus in the left side. So actually there is one principal bronchus on the left side, but there are two bronchus on the right lung. So the superiormost structure in the right lung hilum is eparterial bronchus. Then we will have the pulmonary artery. Then we will have hyparterial bronchus. Then we will have inferior pulmonary vein. Then we will have inferior pulmonary vein. Okay. Now arrangement of structure in the root of lung from above to down in left lung. In which lung? In left lung. In right lung is already written, and in left lung. So that relation will be, the superiormost structure will be pulmonary artery, then the left principal bronchus, then will be inferior pulmonary vein. Done. Now I just want you to see this image. The bronchial tree. I want everybody to understand the bronchial tree. So what is bronchial tree? Actually, the trachea will divide into principal bronchus of right and the left side, and this right bronchus will again divide into ep and hyparterial bronchus. So this go on division segmentally. But if you will see the right bronchus, so this is left and this is right. So right bronchus is slightly wider than the left, and it is slightly shorter than the right one is shorter and wider than the left, and angle of deviation of right bronchus is less than the longitudinal axis of trachea. So there is another image for it where you can see this is the trachea, and here you can see this is the left bronchus. This is the left bronchus and this is exactly the right side bronchus. So you can see right bronchus deviation is, if you will see the right bronchus deviation, the right side bronchus deviation is just 25 degree and the left side bronchus deviation is just 45 degree. So that means the right side will be commonly, the foreign body will be traversing into the right side because this is lying in more of longitudinal axis. So you can see this is the longitudinal axis of the trachea. This is the longitudinal axis of the trachea. So this angulation is less. 25-degree angulation is less. So there is more chance of foreign body to inhale foreign body structures to be traversing into the right side than the left side, because left bronchus you can see more longer, more slightly narrower than that of the right bronchus, and angle of deviation is also more in the left side. So foreign body, so here one more image is there where you can see aspiration. Where you can see, so here you can see the foreign body or aspiration. So here you can see the foreign body, this is a foreign body, and here also you can see it is traversing into the right side than the left side. The reason is that the right bronchus is less angulated. It is only 25-degree deviated from the longitudinal axis of trachea in comparison to left lung, which is 45-degree angulated or deviated from the longitudinal axis of trachea. Aspiration of foreign body. So you can just write on aspiration of foreign body is common on right side because right bronchus is wider, shorter, right bronchus is wider, shorter and less angle of deviation, that is 25 degrees from the longitudinal axis of trachea, from the longitudinal axis of trachea. From the longitudinal axis of trachea. That is the reason. If we talk about angle of deviation of the left hand side, the angle of deviation of left bronchus is 40. The angle of deviation of left bronchus will be, the left bronchus angle of deviation is 45 degrees, but right bronchus angle of deviation is just 25 degrees. Right bronchus angle of deviation is just 25 degrees. Now let's see the bronchial tree. Actually, the whole of respiratory tree is categorized as the whole of respiratory tree will be categorized as that of conducting part and respiratory part. Conducting part. So if I talk respiratory, where actual exchange gases, exchange of oxygen and carbon dioxide takes place. Conducting part is for the humidification of inspired air. So basically the conducting part, trachea, bronchus, secondary, tertiary, and then comes the terminal bronchi, which is from, that is a junction of the conducting and the respiratory part. Then we have a respiratory bronchi, alveoli, alveolar duct and alveoli, which are the important part of the respiratory part of the bronchial tree. Now, bronchopulmonary segment, a very important topic. Bronchopulmonary segment. So, I first like to describe what is bronchopulmonary segment. I want to define. So, when I am talking about bronchopulmonary segment, it is a well-defined wedged-shaped sector of the lung. It is aerated by segmental bronchus. So, that is the definition. It is the well-defined sector of lung, and bronchopulmonary segment is regarded as structural and functional unit of the lung, which is well-defined wedge-shaped section of the sector of the lung aerated by segmental bronchus. The features, thereafter I would all like to tell you about the features of bronchopulmonary segment. So it is a subdivision of lobe of lung. It is having a pyramidal shape in which apex is directed towards the hilum, the base is towards the surface of the lung, basal aspect, surrounded by connective tissue, and it is aerated by segmental tertiary bronchus has its own arterial supply via the segmental pulmonary arteries and also has its own lymphatic drainage. Actually, what is important for you to note down is intersegmental course of pulmonary vein. So you can see, if you will see the pulmonary venules, if you will see the pulmonary venules, this pulmonary venules tributaries, actually pulmonary veins are intersegmental in location. Otherwise, all this structure, pulmonary artery, bronchus, bronchial artery, all are lying in one bronchopulmonary segment, but the location of veins is intersegmental. That is an important definition of bronchopulmonary segment which has to be known to you. So please write down bronchopulmonary segment is defined as functional, structural, well defined, wedge shaped sector of lungs aerated by segmental bronchus. Aerated by segmental bronchus. Now talking about the features, so please write down features, write down clinical features, write down features. So it's a subdivision of, it is a subdivision of lobes of lung. It is pyramidal in shape, it is pyramidal in shape. So it's pyramidal in shape. In which the apex is directed towards the hilum. The base is directed towards surface of lung. Surrounded by connective tissue. Fourth point, aerated by segmental or tertiary bronchus. Tertiary bronchus has its own, if I talk about bronchopulmonary segment, it has its own artery supply, that is segmental branch of, pulmonary artery. It has its own, the next thing is it has its own lymphatic drainage and autonomic nerve supply, Actually, these are the important characteristic feature and the location of veins. If I talk about the location of veins, that is the tributaries. Pulmonary veins are all intersegmental. So here one of the important point which you can just characterize here, location of pulmonary veins. Location of pulmonary veins are intersegmental. Location of pulmonary veins are intersegmental. Done. Now we will talk about the right and the left bronchopulmonary segment. So if you will see the right and the left bronchopulmonary segment, you can see in so we know that right lung is having 3 lobes, but always so it's important to know the right bronchopulmonary segment is having 10 bronchopulmonary. The right lung is having 3 lobes and it is having 10 bronchopulmonary segment. So the upper lobe is having apical, anterior, posterior bronchopulmonary segment. The middle is having medial and lateral, and the lower is having superior, medial, basal, anterior, basal, lateral, basal, and posterior basal. So altogether, if I am talking about the right lung is having bronchopulmonary segment that is 10 in number. So we have got 10 bronchopulmonary segment in the right lung and we have got 10 bronchopulmonary segment in the left lung. In the right lung, there are 3 lobes and the name of bronchopulmonary segment has been shown to you. If I am talking of the left lung, it is also having 10 bronchopulmonary segment in the 2 lobes most of the time. That is, it will have upper and the lower lobe having in the upper apical, anterior, posterior, superior, inferior, lingual, and in the inferior lobe we have got superior, middle, anterior basal, posterior basal, and lateral basal. So altogether 10 bronchopulmonary segment are there in the right lung and there are 10 bronchopulmonary segment in the left lung. But at times there is deviation. So at times, but I will write about that. I just want everybody to see this image. So this is showing you the view of the bronchopulmonary segment in both the lungs. Okay, this is the bronchopulmonary segment of both the lungs. But if you will see this table, you can understand that all the time, the right lung is always going to have 10 bronchopulmonary segment. Always, always. So there is 10 bronchopulmonary segment in the right lung. And most of the time, left lung is also having 10 bronchopulmonary segment. 10. So here just write across, but sometimes it will have 8 bronchopulmonary segment. When the, here you just mark it, the reason is apical and posterior. So when it is having 10 bronchopulmonary segment, you can just mark it. It will have 10 bronchopulmonary segment. Apical and posterior of superior division will unite to form one bronchopulmonary segment, and basal, anterior, medial will join to form one bronchopulmonary segment. So this is seen in few of the cases, that is, so this is seen in few of the cases. So that is important for you to note down. So this has asked in the previous year of examination, always the right one will have 10 bronchopulmonary segment, the left at times can have 8 bronchopulmonary segment because of the fusion of apical posterior in the superior lobe. Apical posterior is fusing, as you can see, apical posterior AP, and basal anteromedial is merging. So write down bronchopulmonary segment. There is there is 10 bronchopulmonary segment in right lung always. There is 10 bronchopulmonary segment in left lung, but sometimes the apical and posterior, but sometimes, yes, good afternoon Akshay, but sometimes left lung can have 8 bronchopulmonary segment. Why? Because of the fusion of apical posterior, basal anteromedial, because of the fusion of apical posterior and basal anteromedial, basal anteromedial. So this is the fusion of bronchopulmonary, 2 bronchopulmonary segment will fuse here. This 2 bronchopulmonary segment of upper lobe will fuse, and these 2 bronchopulmonary segment of lower lobe will fuse, and this will lead to the formation of total how many bronchopulmonary segment? Just 8 bronchopulmonary segment in the left side, but right will always have 10 bronchopulmonary segment. Now, before proceeding to the MCQs, I just want everybody that in upright or erect position, when the person is sitting, aspiration of the material commonly enters into right lower bronchus and it is entering into right basal bronchopulmonary segment of right lower lobe. So you can just write down this also. clinical aspect you can write down. In upright erect position like sitting or standing position, that means sitting or standing position, aspirated material that is commonly aspirated material commonly enter right lower lobar bronchus in the right lower lobar bronchus in the posterior basal right lower lobe. Okay, this is the condition where the posterior basal right lower lobe is affected, enter into right lower bronchus in the case of erect position. Now I want you to know about the supine position. In supine position, the aspirated material in supine position, the aspirated material will be lodged in superior apical bronchopulmonary segment, and this superior apical bronchopulmonary segment of right lower lobe, of which lobe? Of right lower lobe. So this is affected, and also the other one which can be affected in the supine position is the posterior bronchopulmonary segment of right upper lobe. So basically in supine position, the foreign body aspiration, so basically if I talk about the supine position, just a minute, wait a minute. Yeah, so basically when I am talking about the supine position, the foreign body aspiration can occurs in the apical bronchopulmonary segment of right lower lobe or posterior bronchopulmonary segment of right upper lobe, and in the erect position it can be entering right lower bronchus and affecting posterior basal. It will be affecting posterior basal right lower lobe, okay, done. So done with this. Now, so we had done with this. Now we are going into the details of bronchopulmonary segments. So we will also have now the discussion of few MCQs related to the topic. Is it okay? Can we have those students who are like, I can understand you have to go for your lunch, but let's just quickly go with the discussion of few MCQs related to this topic, and then you can take a break of 5 minutes and then we will start with the session, and few small topics are only remaining. Okay, dear? So let's start. Which one of the following structure is not related to medial surface of right lung? Which of the following structure is not related to, yes, all of you, please mark the right answer. Which one of the following structure is not related to medial surface of right lung? Superior vena cava, thoracic duct, trachea and esophagus. Which of the following structure is not related to the medial surface of right lung? Superior vena cava, thoracic duct, trachea and esophagus. Which structure is not related to the medial surface of right lung? Superior vena cava, thoracic duct, trachea and esophagus. Everyone, I have told you about the mediastinal surface relation of the right side and the left side. So you have to just come to the right answer here. The mediastinal surface relation. So which one of the following structure is not related to the medial surface of right lung? What would be the right answer here? Anyone? Any guesses? The right answer is, here the right answer will be the thoracic duct. Why thoracic duct? I will tell you the reason why thoracic duct, because the thoracic duct is lying in relation to left lung mediastinal surface. So definitely the thoracic duct is the right answer. Okay. The structure not related to medial surface of right lung, the correct answer will be thoracic duct, because thoracic duct is related to left lung hilum surface. Which of the following structure runs in intersegmental plane of the lung? So among this, segmental venules, bronchial venules, bronchus, pulmonary arteries. So according to you, which is the right answer? Which structure is exactly intersegmental in location, not lying in one bronchopulmonary segment? It is intersegmental in location. It is intersegmental in location. So what is the right answer, dear? Which of the following structure runs in intersegmental plane of lung? So the right answer will be, any guesses? Right answer, the structure running intersegmental, not exactly in the bronchopulmonary segment. I have shown you the image also, and the correct answer is segmental venules, pulmonary veins. Which of the following structure is single at the root of each lung? So we have got right and left lung. So which of the following structure? Pulmonary vein, pulmonary artery, bronchus or bronchial artery? Which of the following structure is single in the right side and it is single in the left side? It is not two. What is the right answer, dear? Which structure is single at the root of each lung? Pulmonary vein, pulmonary artery, bronchus or bronchial artery? So yes, dear, the correct answer will be pulmonary arteries are single. So definitely the pulmonary arteries are single. So we have got the right answer. The pulmonary arteries is single, or for both the right and the left side of the root of lung. Now this is question number 4. And then we will have the question number 5th. This is 5th. So please mark the first question. Superior most structure in the hilum of right lung. Superior most structure in the hilum of right lung. Whether this, so we are talking about which side? We are talking about the right side. So superior most structure in the hilum of the right lung, whether it is eparterial bronchus, hyparterial bronchus, pulmonary artery or pulmonary vein. Superior most structure in the hilum of right lung. Eparterial bronchus, hyparterial bronchus, pulmonary artery and pulmonary vein. According to you, which is the right answer, dear? And the correct answer will be, so actually one mnemonic is there, but I want you to understand alphabetically E comes before H. We know that in the right lung bronchus we have got eparterial bronchus, we have got hyparterial bronchus. How you are memorizing that which will come first? So eparterial bronchus will be the right answer. Alphabetically E comes before H, so eparterial bronchus is the superior most structure in the right hilum of the lung. So here this is the right lung, this is the left lung, and we can see, so in case of right side 2 bronchus, in case of left side only 1 bronchus. So you can see this is 2 bronchus on the right side, there is 1 bronchus. So this is eparterial bronchus, and this bronchus which I am talking about is the hyparterial bronchus. So if I have to choose the superior most structure in the right lung, so definitely the correct answer will be eparterial bronchus, which comes before the hyparterial bronchus. Bronchopulmonary segment in right and left lungs are. So actually I have explained you. We know that bronchopulmonary segment for right and left lung is 10 bronchopulmonary segment for right lung, and there is 10 bronchopulmonary segment for left lung. But I have told you that there is apical and posterior merging and basal anteromedial is merging. So basically you have to just recapitulate what I have told you. So always there is 10 bronchopulmonary segment in right, always there is 10 bronchopulmonary segment in left lung, or there is certain deviation. So that I have explained. Please mark the right answer. I will give you few seconds, 30 seconds to mark the right answer. All of you please try. So always the right lung will have 10 bronchopulmonary segment. Left lung की बात करें, if we are talking about the left lung, it is having 10 bronchopulmonary segment, but at times it can have 8 bronchopulmonary segment, because the apical posterior of the upper lobe will join to form one bronchopulmonary segment, and also there will be fusion of the basal and anteromedial of the lower lobe in the left hand side. So that means 10 bronchopulmonary segment will be always in the right, and there can be 8 bronchopulmonary segment in the left side. Hello everyone. So let's start with the session. So already we have completed very important topic. Few small topics are remaining which I have to complete. So let's start. Without wasting much of the time, we have to complete the entire session. Hello everyone. So let's okay, I was just checking whether I am audible or not. So I am audible, everything is clear, so that we can start the session. Okay dear? Okay. So considering that FMGE entrance exam, the trachea and esophagus is an important topic which has to be done. So here in this diagram, you can see the trachea. So if I talk about the entire length of the trachea, it is 25 centimeters, and it is extending from C6 to that of T4 thoracic vertebra. This is the entire extent of trachea. This is the entire extent of the trachea. It is extending from C6 to T4 thoracic vertebra. Okay. So if I talk about the trachea, it's a fibrocartilaginous tube. The lumen has to be kept patent, and the lumen is kept patent by 16 to 20 C-shaped ring, which is made of hyaline cartilage. So trachea is fibrocartilaginous, so we have to know about the location and the extent. So what is trachea? Please note down. Trachea is a flexible flexible fibrocartilaginous tube. Lumen is kept If I talk about the lumen of the trachea, so the lumen is kept patent by 16 to 20 C-shaped rings. So this 16 to 20 C-shaped ring is called as hyaline cartilage. Is made of hyaline cartilage. Okay, these rings are made of hyaline cartilage. Now it's important to know the extent and location. So if I talk about the we will also talk about the dimension. So before that, if I talk about the extent, trachea is extending from if I talk about the trachea is extending from lower border of cricoid cartilage, that is C6 cervical vertebra, to that of T4, that is in the thorax region. And exactly if I talk about the extent, it is extending from C2 to T4 in the supine position. The extent is C6 to T6 in the erect position or standing position, and it is extending from C6 to T3 in newborns. Now it's also important to know the dimension of the trachea. So it's important that we should have an idea of dimension of trachea. So please write down about dimension. Length is corresponding to 10 to 12 centimeters. External diameter is corresponding to 2 centimeter in males and 1.5 centimeters in females. Internal diameter, if I talk about internal diameter is corresponding to 12 mm in adults and it is corresponding to 3 mm in newborns. Okay, so this is about the dimension. This is about the dimension of trachea. So this is about the external diameter, and this is about the internal diameter. External diameter is 2 centimeters in the males and 1.5 in the females. Internal is 12 mm in adults and 3 mm in newborns. It's also important to know about the course of trachea in brief. So if I am talking about the course, please write down. Trachea is actually, if I talk about the trachea, it is a continuation. So please write down, trachea is continuation of larynx. It begins at the lower border of cricoid cartilage, and we need the lower border. The whole of cartilage is corresponding to which cervical vertebra? So lower border of cricoid cartilage is corresponding to C6 cervical vertebra. It is corresponding to C6 cervical vertebra. To the level of tracheal bifurcation, to the level of tracheal bifurcation, and this tracheal bifurcation is corresponding to T4 level. Now it is important to know the microscopic features of the that of the trachea. So when I am talking about the microscopic features, what you can see, the lining epithelium of trachea is a pseudo-stratified ciliated columnar epithelium. So it is pseudo-stratified ciliated columnar epithelium. So trachea will have mucosa, which is consist of lamina propria, will have mucus glands, tracheal and mucus glands, mucus and serous both. There is perichondrium covering of the hyaline cartilage. It is also having hyaline cartilage. So mucosa is consist of the mucosal. So we will have the mucosa, we will have the submucosa, we will have the muscularis externa, and outer will be the fibromucus, fibromembranous coating, which is adventitia. So the lining epithelium is ciliated columnar, pseudostratified ciliated columnar epithelium. And if we see the high power view, it is pseudostratified ciliated columnar lamina propria. There will be tracheal glands and there will be hyaline cartilage, which is having a covering of perichondrium. So these are the two images which has been shown to you, which is showing the microscopic features of the trachea. So please write out. So the innermost layer is the mucosa. So from outside to inside, there is mucosa, and the mucosa is made of epithelium. The epithelium is of, if I talk about the epithelium of the mucosa, the epithelium is made of pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium. The next layer is lamina propria, and the lamina propria is containing glands, which is both serous and mucous gland, both seromucous gland, which is both serous and mucous. So we will use the word seromucous gland is there. And the third is muscularis mucosae. Muscularis mucosae. The third layer is muscularis mucosae. Now, this was the first layer. The second layer, if I am talking about, is of submucosa, which is containing okay. So basically, it's important to know that if we are talking about the trachea, that there is mucosa muscularis. So there is also few fibers, but and there is actually trachealis muscle is there. So there is some mucosa, there is a trachealis muscle. So I will come more, please don't get confused. Important aspects I just want to write because you can get confused. So there is muscular, there is trachealis smooth muscle, there is trachealis smooth muscle layer, and there is also C-shaped hyaline cartilage. C-shaped hyaline cartilage. There is a C-shaped hyaline cartilage which is covered by the C-shaped. If I talk about the C-shaped hyaline cartilage, so if we are talking about the C-shaped hyaline cartilage, it is important that this C-shaped hyaline cartilage is made of, it is having a covering which is having also the perichondrium covering. Sorry, this is also having a perichondrium covering. And the outer is the fibrous membrane. The outer is the fibrous membrane. Here also the second layer will be, here you can write the submucosa layer also. So submucosa layer which contains seromucous gland. Seromucous gland. Now, vascular, important is the vascular supply. So basically, blood supply is via inferior thyroid artery. So basically, if I talk about the trachea, the blood supply is via inferior thyroid artery, and that is basically giving blood supply to trachea. That is important. And basically सबसे important trachea में इसके dimensions है and histology part है. Okay, other than that, inferior thyroid artery is there. Venous drainages to the left brachiocephalic vein. Left brachiocephalic vein. Lymphatics will be draining to pretracheal and paratracheal lymph nodes. Now nerve supply, the nerve supply will be both sympathetic and parasympathetic. The parasympathetic will be sensory and secretomotor, secretomotor and secretion, and will be motor to trachealis muscle. Will be motor to which muscle? It will be motor to trachealis muscle. Will be motor to trachealis muscle. Now the next we have to know, so let's talk about the next one. So next is to know about the next important structure which I want everybody to understand is the is that of esophagus, and we'll come to the azygus. Okay, esophagus. So esophagus is a narrow muscular tube. It's a narrow muscular tube which is starting from the pharynx to the stomach. It is starting from the level of pharynx to the stomach. It is 25 centimeters in length. It is 25 centimeters in length. That means 10 inches. The course. So I just want you to know it also start as a continuation of pharynx, continuing at the level of cricopharyngeus, as you can see here at the pharyngoesophageal cricopharyngeus, and ending at the cardiac orifice. It is ending at the cardiac orifice of the stomach. This is about the esophagus. So write down, and width is, this is about length. Now course. Esophagus begins in the neck at the lower border of, so it begins in the neck at the lower border of cricoid cartilage, basically at the level of C6 cervical vertebra, and descends in front of vertebral column and thereafter it passes in superior and then to the posterior mediastinum. Thereafter it pierces the diaphragm, at T10 level, and it continues in the abdomen with the stomach. So it continues in the abdomen with the cardiac orifice of the stomach, with the cardiac orifice at the T11 level. So this is overall esophagus course which I have told you in brief. This is the overall course which I have told you in the brief. Now it is also important to know the constriction of esophagus, which is highly important. We will talk about constrictions, then we will talk about arterial nerve supply and microscopic features. Then I would like to discuss few MCQs and we will go into azygus system of vein. Okay, let me explain the anatomical constrictions of esophagus. Let me just check with the students, are they understanding? So, yes, good afternoon, Dr. Sarma. So, are you understanding everyone? So, like two small topics, we have already finished the thorax part, important topics. Few small topics are remaining, which has been asked in the previous year of examination. One is the constrictions of esophagus anatomical. So, we have got 4 levels of constriction. So, if you just see, there is, and here their distance of these constriction from upper incisor teeth has to be known to you. So, we have got cricopharyngeus constriction, that is pharyngoesophageal junction, where the pharynx continues with the esophagus. Then we have got arch of aorta, then we have got left principal bronchus, then we have got the esophageal opening of the diaphragm. So these are the 4 constrictions. So you have to know the site of constriction, you have to know the vertebral level of this constriction, you have to know the distance of this constriction from upper incisor teeth. These are important points. So write down. So first thing is anatomical sites of constriction. So you can just name it. The constrictions are 4. Pharyngoesophageal junction, at crossing of arch of aorta, at crossing of left principal bronchus, and at opening of diaphragm. T10 opening of vagus also have more, yes, that is diaphragmatic opening. Yes, Dr. Sarma, at opening of diaphragm. Yes, Dr. Sarma. Now I will make a chart for you. So here you can see the site of constriction. So we can see the cervical constriction, pharyngoesophageal junction approximately 6 inches 15 centimeters. Aortic constriction is 9 inches 22 centimeters. Left principal bronchus is 27 centimeters 11 inches, and diaphragmatic opening is 40 centimeters 15 inches. Now I just want everybody, before proceeding, our site of constrictions, you have to know the details. So site of constriction you can just write down. You can write at one point site, at another point you can write the vertebral column. Third is distance from upper incisor teeth, Now write down. First site of constriction is pharyngoesophageal junction, and the vertebral level corresponding is C6 cervical vertebra, and the distance from upper incisor teeth is 15 centimeters corresponding to 6 inches. Okay. The next is, the second constriction level is at crossing of arch of aorta. This is at T4 level and this is 22 centimeters or 9 inches from incisor teeth. The third level is at crossing of left principal bronchus. That is at the level of T6. That is at the level of T6, 23. Approximately 27 centimeters and 11 inches. And the fourth level of constriction is at opening of diaphragm, at the opening of diaphragm. And if I talk about the opening of diaphragm, that level is corresponding to T10 and the distance will be 40 centimeters or 15 inches from the upper incisor teeth. So basically we have done with all the constriction levels and their vertebral level and their distance from the incisor teeth. That is already done. Now coming to the next, arterial supply. Diaphragm 40 cm. Yes, Dr. Sarma Punit, you are right. Yes, you are absolutely right. So I would like to talk. Yes, you are absolutely right. Arterial supply. So arterial supply, I will categorize the esophagus into 4 parts: cervical part, thoracic part, abdomen part. So basically I just want to categorize and divide the esophagus into 3 components. If I have to talk about arterial supply, I will divide the entire esophagus into 3 components. It is having a cervical part, it is having a thoracic component, it is having a abdominal part, and we will talk about its arterial supply in the 3 components. So what is this arterial supply? So the supply is, cervical part is supplied by inferior thyroid artery. Thoracic part is supplied by branches from descending thoracic aorta. And also from left phrenic artery. Yes, absolutely right. Absolutely right, dear. Abdominal part is via esophageal branches of left gastric artery and inferior phrenic artery. And which artery? Inferior phrenic artery. Okay, these are the 3 parts and there are 3 parts arterial supply has been designated. Okay, venous drainage nerve supply. Okay, venous drainage, if you want to know, the venous drainage is cervical part is draining into inferior thyroid vein. Thoracic part is draining into azygous and hemiazygous vein. Abdominal part left phrenic yes, so that is the abdominal part, no, continuing with it. Dr. Sharma, esophageal end or lower part will be in the abdomen, no, it will pierce the diaphragm. It will piercing at the diaphragm. So it is at that junction level only, no, Dr. Sharma. That is at the junction level only. Abdominal part. Esophagus will continue with the, so that junction is inferior phrenic artery. Inferior phrenic artery. Abdominal part via two venous channels. Via two venous channels, that is, so please write down. If you are getting confused, you can write the junction of thorax and abdominal part. It is via hemiazygous. It is via hemiazygous draining into inferior vena cava. Left gastric vein, then portal vein. Okay. Nerve supply of esophagus is sympathetic and parasympathetic. So sympathetic innervation will be via T5 to T9 and parasympathetic will be via vagus, via vagus nerve. Yes, yes, Dr. Sharma, yes, Dr. Sharma. Written. Now coming to the microscopic feature. Now coming to the microscopic feature. So microscopic feature is important. So if I am talking about microscopic feature histology of the esophagus, you can see the lining mucosa, submucosa, muscularis mucosa, and the fibrous membrane on outside. So from inside to outside, we will have the layers. Mucosa. The lining epithelium is stratified squamous, non-keratinized epithelium. Lamina propria will contain cardiac esophageal gland. Proper esophageal gland will be in the submucosal layer, muscularis externa, and then we will have the outermost fibromembranous layer, which is corresponding to adventitia. So write down microscopic features. Mucosa, the innermost layer is the mucosa, which is having the epithelium layer. If the epithelium is stratified squamous non-keratinized epithelium, stratified non-keratinized which layer is absent? You know that esophagus is having all the layers, but different area is different. For example, at most of the part there is adventitia layer, but at muscle layer we have got different composition. In the upper part there is skeleton muscle, in the middle part there is smooth skeleton muscle, both in the lower part there is just smooth muscle. Okay, but it is having the layer of GIT. You are getting confused with gallbladder. Dr. Sharma, gallbladder is the layer which is having few layers not present like submucosal layer. But in esophagus there is layers, only the deviation is there in the layers. Okay. Stratified squamous non-keratinized epithelium. Then we will have lamina propria. Then we have muscularis mucosae. The lamina propria will have esophageal cardiac gland, will have esophageal cardiac glands. The submucosa layer will have We'll have esophageal proper gland. We'll have esophageal. Yes, that gallbladder is not having the submucosa layer. Gallbladder is not having the submucosa layer and the lamina propria. Okay. So submucosa layer is esophageal gland proper. Then we have got muscularis externa layer. So in upper part, it is just made of stratified. So in upper part, it is just made of skeleton muscle. In the middle part, it is having both skeleton and smooth muscle. It is made of both skeleton and smooth muscle, both of it. In the lower part, it is made of just smooth muscle. The fourth layer is, if we talk about fourth layer, the fourth layer is fibrous membrane, which is corresponding to adventitia layer, Done? Done everyone? Microscopic features. So we have done with the microscopic features. Let's solve few MCQs related to this topic. Okay, can we solve few everyone? Let's solve few MCQs. Indentation in the esophagus is made by all except. So indentation in the esophagus is caused by all except. Indentation in esophagus is caused by all except. Indentation in esophagus is caused by all except. Question number 1. Aortic arch, left atrium, left bronchus, left ventricle. Indentation in esophagus is caused by all except. So I am just waiting for few seconds. Dr. Sharma Punit has given the right answer. What about others? What about others? Dr. Sharma Punit has given the answer. And he has given perfectly right answer. Yes, left ventricle is the right answer, which is not producing any kind of indentation in the esophagus. Absolutely correct. Moving to the next. In mitral stenosis, barium meal. In mitral stenosis, barium meal is done to see compression of esophagus due to enlargement of which of the following structure? Right atrium, left ventricle, right ventricle. So which chamber of the heart when it is enlarged? Common sense. Esophagus is lying anterior or posterior. So which chamber of the heart is enlarged? That can cause compression of the esophagus. In mitral stenosis, barium sallow is done to see the compression of esophagus due to enlargement of which of the following structure? So Dr. Sharma Punit is absolutely right. Dr. Sharma Punit, you are absolutely right. It is the left atrium. Absolutely correct. Left atrium is forming the base of the heart and it will lie posterior. So when it enlarges, it will compress the posterior structure of the posterior mediastinum and absolutely the esophagus can get compressed. Absolutely correct. Again, a very good. So very good, Dr. Sharma Punit. Absolutely correct. Very good, dear. Very good. Yes, because left atrium is forming the base Left atrium is forming the base of the heart. Posteriorly, it is related. It is from the base of the heart. So it will lead to the compression. Yes, you are absolutely right. Now we have got two small topics. One is azygous system of vein and the other is thoracic duct. Last two topics. So I will take another half an hour and we will finish with the session. Azygous system of vein. Azygous system of vein. What do you mean by the word azygous? Anyone, what do you mean by the word azygous? Anyone, what do you mean by the word azygous? What do you mean by the word azygous system of veins? So when I am talking about azygous system of veins, it means, so the word azygous means without companion. The word azygous means without companion. Single. Yes, you are right. Yes, Puneet, you are right. Yes, you are right. So basically, when I am using the word azygous system of veins, it means it is consisting of azygous vein. It is consist of accessory hemiazygous. It is consist of hemiazygous. So these are the three veins which will together form the azygous system. One by one I am telling about all. So azygous vein, please write down, azygous vein means without companion. Azygous vein is present only on right side in upper part of posterior abdominal, in upper part of posterior abdominal wall and posterior mediastinum. And posterior mediastinum. It connects superior vena cava and inferior vena cava. It is provided by valves. It is provided by valves, so it appears tortuous. Okay. Course and termination. So let's talk about course and termination. Before that, formation is also important. So firstly, I will talk about formation, then tributaries. So first point which everybody should understand is formation. Formation is variable. It is formed by the union of, right subcostal vein and ascending lumbar vein. So actually right subcostal and right ascending lumbar vein, this is most common. This is actually most common formation. This is most common formation, but sometimes the formation can be variable also. This is the most common formation. Sometimes it can be formed, it can arise directly from posterior aspect of, inferior vena cava. Near renal veins. It can also arise as a continuation of right subcostal vein. Occasionally it can arise from right renal and right first lumbar vein. So actually variable origin and formation is the most common is the joining of right ascending lumbar. The most common, if I talk about the most common, it is by the right ascending lumbar vein and right subcostal vein. Now further course after formation it ascends up and leave the abdomen via aortic opening of diaphragm. It enter the posterior mediastinum. Ascends vertically upward. So it is entering in the posterior mediastinum, then it is ascending vertically up, lying in front of vertebral column till the level of T4 thoracic vertebra. So at T4 thoracic vertebra, what happens? It arches above the hilum, and at T4, so here, and at T4 level, it arches in the hilum of right lung, where it terminates, and it terminates in superior vena cava, and it will terminates in superior vena cava, and this occurs at the level of second costal cartilage. This occurs at the level of second costal cartilage. It occurs at the level of second costal cartilage. Now tributaries, if you will see the azygos vein, you can see the tributaries are second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, or so exactly these are all the tributaries. So we have got the posterior intercostal veins. So we have got the posterior intercostal veins. Also these three together is forming superior intercostal veins of the right side. We have got the right subcostal lumbar vein as right subcostal bronchial vein. So please just write down the name of the tributaries. Tributaries of azygos vein. The tributaries of azygos veins are commonly following: lower 7 right posterior intercostal vein, right superior intercostal vein, which is formed by the joining of second, third and fourth, right posterior intercostal veins. Then we have got hemiazygos vein. We have got hemiazygos vein as accessory hemiazygos vein draining into it. We have got accessory hemiazygos and accessory and hemiazygos vein draining to it, and the other are right subcostal vein. We have got right bronchial veins draining into it, We have got esophageal veins and mediastinal veins. Esophageal veins, mediastinal veins. And we have got the pericardial veins. Pericardinal veins. All these veins drains into azygos. Done. Now coming to hemiazygos and accessory hemiazygos veins. So when we are talking about azygos and hemiazygos, that is also important for you to know. If I am talking about hemiazygos vein, it is also called as inferior hemiazygos vein. It is called inferior hemiazygos vein. Why it is called as inferior hemiazygos vein? Because it is a mirror image of lower part of azygos vein. It is the mirror image of lower part of azygos vein. You can see this image also and you can understand. See here. Here this is the hemiazygous vein, and you can see hemiazygous vein will be the mirror image of lower part of azygos. Accessory hemiazygous is the mirror image of upper part of azygous vein. So inferior hemiazygous, formation, union of left ascending lumbar vein, left ascending lumbar vein and left subclavian vein, and left subclavian vein. Tributaries. So here write down the tributaries. The tributaries are lower 3, that is 9, 10, 11, left posterior intercostal vein, left subclavian vein, left ascending lumbar vein, left ascending lumbar vein, left ascending lumbar vein, small esophageal vein. So we have got esophageal vein and mediastinal vein. So all these are the tributaries of hemiazygous vein. All these are the tributaries of hemiazygous vein. And lastly is the accessory hemiazygous vein, which is also called as superior hemiazygous vein. And if I talk superior hemiazygous vein, it is the mirror image of upper part of azygous vein. Begins where, so this is begins at medial end of 4th, 5th intercostal space at the level of T8. So basically it is at the level of T8. So basically you can see this is the T8 level where you can see upper and lower part, the two upper part as accessory hemiazygous, lower part hemiazygous. Okay, now the tributaries. The tributaries are 5th to 8th left posterior intercostal vein, left posterior intercostal veins, and the other tributary is, it is also having the tributary that is left bronchial vein, the left bronchial vein. So we have finished with the azygous system of vein. I just want to solve few MCQs along with you, and then we will have the last topic, that is thoracic duct. In brief, we have to talk about thoracic duct. Is it okay? Can we start with the MCQs related to this topic? Just a few MCQs. Left superior intercostal vein drains into which of the following vein? Left superior. I have told this in the thorax intercostal space also. Left superior intercostal vein. This is a topic of intercostal space MCQ. Left superior intercostal vein drains into which of the following? Azygous vein, hemiazygous vein, left brachiocephalic, or innominate vein. So you can just give me the right answer. Right answer, dear. Last tributary. Anyone? Not knowing? It's the bronchial vein. It's the bronchial vein which is the last tributary. It's the bronchial vein. Hemiazygous vein crosses to the left to right, and this crossing over of right and left occurs at which level? Hemiazygous, I have shown you that vertebral level where they are draining, that is only asked. Easy one. Hemiazygous vein crosses left to right, and this happens at which level? Any answers? It happens at T8 level. It happens at T8 level. Now the last topic of thorax, thoracic duct. So basically if I am talking about thoracic duct, So it's if I'm talking about thoracic duct, it's the largest lymphatic channel. It's the largest lymphatic channel. So it's the largest lymphatic channel, and basically it is draining most parts. So exactly if I talk about thoracic duct, it is basically draining, so basically it is draining most part of the most lymphatic drainage of the body. So if I talk about important area of drainage, it is draining all the parts of the body except, so you can write largest lymphatic channel, you can write here, drains lymph from, it drains lymph from all parts of body, all parts of body except right side of head and neck, right side of head and neck region, right side of chest wall, right side of chest wall, right lung, right lung, right side of heart, and right surface of the liver, and right surface of the liver, and right surface of liver. So basically these are the area of drainage of thoracic duct. The course termination and formation will be done in brief. So it will be done in the brief. So exactly if I talk about the extent, course termination, formation and tributaries. So basically thoracic duct extends to the upper end of cisterna chyli, which is lying in the posterior abdominal wall, at the lower border of T12. It continues and drains into left, it drains into left side at the junction of left internal jugular vein and that of left subclavian vein, left subclavian vein, and this happens at the root of neck. Where this happens? This is happening at the root of neck. Okay. So basically you can understand the formation of thoracic duct by seeing this image. So this image didn't came clearly. So basically I will just explain. This is cisterna chyli, this is cisterna chyli, from where at the level of T12 it starts to form, then it is passing upwards and it is changing its direction at the level of T5. It is direction is changes from right to left, it goes, and ultimately it is draining at C7 level. So exactly at the C7 level it is draining at the junction of left internal jugular vein and left vagus. So exact left internal jugular and left subclavian vein. So very briefly you can write thoracic duct begins at the level of T12 from cisterna chyli, from cisternae chyli, which is located at, cisterna chyli is located at the level of L1 and L2. It enters the thorax, then it enters the thorax through aortic opening of diaphragm, through aortic opening of the diaphragm, and we know that aortic opening of diaphragm is also at the level of T12. Then on reaching T5, on reaching T5 level, on reaching the level of T5, it changes its direction. It is changed direction. It is changed the direction. It changed the, so it changed the direction from right to left. That is from right to left. Then it passes in the superior mediastinum. Then it passes in the superior mediastinum. then it passes in the superior mediastinum and in the root of neck, and in the root of neck at the level of C7 cervical vertebra, it drains into the junction of, left subclavian and left internal jugular vein. So this is the entire course of thoracic duct. It is the entire course of the thoracic duct. Now I just want quickly for you to know the few tributaries, important tributaries of the thoracic duct, which is important. So basically we can categorize the tributaries like this. Okay, the first, I just want in abdomen the tributary. So basically in abdomen, it is receiving efferents from, it receives efferents from lower 6 intercostal lymph node, lower 6 intercostal lymph node, lower 6 intercostal lymph node, intercostal lymph node of both the side. Okay, so this is exactly, you can see. So this is the cisterna-Cali intestinal duct, thoracic duct. It is basically having the drainage. So basically it is having in the thorax also, it is draining from the ascending lymph trunks. It drains from the ascending lymph trunk is there, then it is draining from the left bronchomediastinal lymph trunks, and all this in the subclavian and jugular lymph nodes. So all these are the tributaries. So we have done with this in the abdomen, and just write down in thorax. In thorax, the tributaries are a pair of ascending lymph trunk. From actually a pair of ascending means upper lumbar lymph node, that is upper lumbar lymph nodes, and that of para-aortic group of lymph nodes. In thorax, it also drains lymph from descending from a pair of, so it also from a pair of lymph trunks, descending lymph trunks, and this is from posterior intercostal lymph node, that is from posterior intercostal lymph nodes of upper 6 intercostal space. Also it drains lymphatics from posterior mediastinal lymph nodes, Okay, now talking about the lymphs from the neck. So we have done in the abdomen, we have done the lymphatics drainage efferents reaching the thoracic duct in thorax, and then in the neck region. So the third is in neck. So in the neck, it is draining lymphatics from left jugular lymph nodes or lymph trunks, you can say left jugular lymph trunks, from the neck, also from left subclavian lymph trunk, and the other one is left bronchomediastinal lymph node, the last left bronchomediastinal lymph node, also from left bronchomediastinal lymph node. So done with this. So we have got following lymphatic drainage which we have done about the thorax, and that is absolutely important. Okay. So yes, we have finished with this. Can we have an MCQ related to this? So I will just check with the students also. So we have done with the thorax topic, but I just want to solve one MCQs related to this topic. Everyone, let me just check the mobile, and yes dear. Yeah. Right to left side vertebral column T5. Right to left side T5 dear. T5. T5 at the level of T5. At the level of T5 dear, Dr. Sarath, at the level of T5. So thoracic duct begins at which level? What is the beginning point of thoracic? Thoracic duct is beginning at which level? Can you give me the answer? Is beginning at which of the following level? Thoracic duct begins at which of the following level? T12, L2, C7 or T10? It starts from the cisterna cali at which level? Beginning. They are asking about beginning of the thoracic duct. I told you it is starting from the cisterna cali. Can you tell me at which level it happens? At which level it happens? That's starting of thoracic. So A, Gajendra has given the answer. What about others? Gajendra has given the answer. What about others? So absolutely a right answer is given by Gajendra. Anyone else wants to give the answer? Absolutely a correct answer is given by him. I told you so it starts from cisterna cali at the level of T12. L1, L2 is the level where there we have got the cisterna cali, the intestinal limbs are draining, and from the cisterna cali, the thoracic duct begins at the level of T12. So yes, T12 is the right answer, dear. Now we have finished with the topic of entire thorax, and I hope the session is useful for you. Before ending, I just want you to summarize what all things we have completed. So we have completed in the first topic thoracic wall, then we have gone into the details of substance fascia, suprapleural membrane, its attachment, its clinical aspect. We have discussed thoracic inlet syndrome. We have discussed the clinical anatomy. We have discussed intercostal space, the structures, intercostal nerves, typical, atypical. We have discussed intercostal muscles. We have discussed about intercostal artery, both anterior and posterior intercostal artery. We have discussed about intercostal vein, different drainage on the right and the left side. We have also discussed about expiratory list of muscle and inspiratory list of muscle. We have also discussed about lung and the pleura. We have discussed about the apical, basal, costal, mediastinal parts and their relation. We have discussed about bronchopulmonary segment. We have also discussed about tracheal bifurcation, the primary and the secondary principal bronchi. We have discussed about foreign body tracing into the right bronchus, the reason. We have also discussed about mediastinum. We have discussed how mediastinum is divided into superior, middle, inferior, posterior mediastinum, and what are the contents of all the part of mediastinum. We have seen the transverse section of all the structures lying there. We have talked about detail in the pericardium, the sinuses, the coverings, and the arterial supply, the nerve supply, the oblique and transverse sinus. We have also talked in detail about the heart, the coronary arteries, the nerve supply, the cardiac plexus, the interior of right atrium, the Koch triangle, the fossa ovalis, the limbus fossa ovalis. We have discussed about cardiac plexus. We have discussed about trachea, esophagus, the microscopic feature, the dimensions, the extent, the constriction of esophagus. We have discussed about the histology part of the trachea and esophagus. We have discussed about azygous venous system, hemiazygous, azygous. So many things, and also the thoracic duct. So I hope the session is useful for you. We will again meet in the new topic with a new session starting with the lower limb. I think the details will come in at and you will know when the session, mainly the evening session will be there. Basically at 4 or 5 p.m. I will start on 12th I will start with lower limb, and on 13th upper limb. All the best and keep studying. Thank you so much. We'll meet again in the new session. I hope the session was useful for you. Thank you so much. Thanks dear. Bye. Thanks.